Oh,
I'm good. I couldn't remember what your question was on that.
post-training. Oh, well, I want to hear what they're going to do and what we want, because we want, like, mainly we want juvenile bills that we pass to get the training, but I'm just gonna say generally, bills that come out of the legislature, they need to be trained, the police officers need to be trained, so I don't stand out on that. All right, but I mean, personally, I don't want to, okay, turn off your mic, Tom. Oh, we are, okay, good. Good morning, everybody. Good morning, everybody. I'd like to call to order the Appropriations Committee on Regulation and Protection Subcommittee, State Agency presenters on this wonderful Valentine's Day. Happy Valentine's Day to all of you who are listening to us out there. So I want to call up CHRO and have us start today. Good morning, Tanya. Good morning, Cheryl. Good morning. All right, now you know the rules.
Yes.
You got to say your name when, first time you're at the mic. After that, don't, but make sure that CTN can hear you so that because they actually type your names right in as you answer. So, and we have from 10 and 10:15, but if we go over, it doesn't matter. Anyhow, good morning, good morning, good morning. How are you?
Good morning. I'm Tanya Hughes. I'm the Executive Director at the Commission on Human Rights and Opportunities. With me is our Deputy Executive Director.
Hi, good morning, everyone. I'm Cheryl Sharp. I'm the Deputy Executive Director and a Commission Attorney.
We also brought with us one of our managing attorneys, Attorney Michelle Dumas-Kuhler, as well as our Program Director of Affirmative Action, Janet Tolliver.
Good morning, good morning, good morning. So go right ahead.
So I'm not sure if you wanted us to go through our testimony
No.
or if you just wanted us to
Let's just have
address
a
any
chat
questions.
for a
Sure.
bit, because since you don't have, limited time, I'd rather get into. So I would like to ask first off, do you have anything that you want to bring to our attention? How is your staffing? How is everything? Because we are appropriations and we want to know, and are there some things in the budget that you feel need to be addressed?
Absolutely. Sharp has been working on this very diligently, so I'm going to let Director Sharp. address.
This is not her first rodeo.
No, it's not.
Go right ahead.
You go.
You need glasses?
Oh, I have them. I can't read with them, so that's why I took them off. But so there are a few things. So we are in the governor's budget, we were appropriated for 91 positions, but we currently have 92 staff people and 6 vacancies, which then brings us to 98. We did the budget expansion exercise that OPM has us do, or and we understand it's a very, difficult time, and it's really difficult for us given the climate right now in our nation and within our state. And so we put in for an expansion because we need additional positions in order to meet these rigorous deadlines that we have and the contractual obligations that we have with the EEOC and HUD. I don't know if you've been following some of the headlines, but they're slashing these federal agencies. And we have already just yesterday received additional cases that they requested that we investigate. All of the additional work and investigation requires intake, where individuals contact us and we provide them with information and assist them with filing a complaint of discrimination. Well, there has been a market increase, and so we need to have intake people in each one of our regional offices. And in our affirmative action and contract compliance unit, this is something that we have tried year over year to get based on this critical need. And now the need has just blossomed more than ever. Also, we would point out that at this time, we definitely need everything in our expansion request. It was really well thought out, and we looked at our
That's in your
system.
testimony? Is that-
Yes, and it's included in the testimony, which I don't think there's it's a good use of time for us to just
No.
read through it because you have it in front of you. But I just wanted to highlight, these are critical positions that at this time we need more than ever. And we also put in, for a couple of years, we've been talking about the Civil Rights Museum. The purpose of the museum, obviously, is to carry out one of the prongs of our mission is to educate and advocate for stakeholders. And this is a way that 365 days of the year, we can provide the information and education that is needed so desperately across our nation and in our state, so that we don't roll back the civil rights gains that we've made. And so we will be looking to fund those positions, not in this budget cycle, but in the next. We have a bond bill that is pending right now because we are looking to acquire space in order to house the museum. And so I bring your attention to that. Also, right now, currently, we are running a deficit in personal services, and it's because when we are not allowed to immediately
How much is your deficit?
close to $200,000 was the last information we received. It was $391,000, and then we, as people have left, we haven't been able to refill some of the critical positions because we are showing that projected deficit. But if you look at our overtime, it kind of matches up because we have about $200,000 in overtime. And the issue is that we have these contractual obligations with HUD and with EEOC. to complete the processing of complaints that are dual filed with both EOC and HUD. And in order to accomplish that, when people leave, we have to have people to do the work. We only have so many salaried employees, and so we grant comp time when we're able to do so. Tanya and I are probably working 12 to 16 hours a day to try to just fill in the gaps, but the bandwidth or capacity is like stretched and about to pop. And so we don't want that to happen. We know that we play a critical role in protecting individual civil rights and housing, employment, credit transactions, and in places of public accommodation. And as it relates to the hundreds of millions of dollars of public works contracting that we do, and affirmative action in state agencies. And so we have this awesome responsibility to do the enforcement, the education and outreach, the training, and it costs. And our agency is very small for the amount of statutory responsibility and authority and that we have.
And if I could just
yeah,
add,
we have a
there's
budget
also a position, we need the Director of Communications. As you are probably aware, there's been an increased hysteria around the state and country regarding the changes with the national government. And so because of that, there's an increase in fear, there's an increase in targeting some of our most vulnerable populations. And we're being stretched, as Cheryl said, to respond to these requests, to respond to the increased requests for training, for meetings, et cetera. And so we need a Director of Communications to assist with that as well, because we're pulling on our attorneys who are being pulled in other areas now because of the increased work that we're having.
Thank you. Can you go back? You currently have budgeted for 91 positions, correct?
Correct.
You have, how many positions do you have filled?
We have a total head count of 98. We have a funded head count of 91.
Wait a minute, you have, wait a minute.
So we have 92 positions filled at this very moment. We have 6 vacancies, and when you add that together, that's how you get to the 98. And we're only have been appropriated for 91 positions, and that's where the issue comes in.
So when were you appropriated 92 positions, or how are you paying for that additional position?
We put the request in, and I don't know, somewhere there was a mathematical
They changed
miscalculation or change or addition.
and
And
then-
I'm assuming that coupled with the overtime is why we haven't been allowed to hire even when people have left. We have an attorney 3 that left. We have investigators that left. We haven't been able to refill the positions. If you think about one budget session ago,
okay.
there were 2 durational positions put into the governor's budget, and then we came before appropriations and we indicated that we still needed those 7 durational positions that we had throughout the agency. And so then we were awarded additional funds to cover that.
Okay.
And so just so that you're aware, on June 30th of 2025, all of those durational positions that we have will expire. The 2 that were added to our budget, and then the 7 additional. So that would be 9 positions. But those positions are critical, and we cannot function effectively and efficiently without them. So that's why we are here at your mercy to try to get additional funding.
Are there questions? Are there any questions? If it was happened a year before, remember we didn't do a revision in the budget? They had a position, if we go back, they had a position that was available. They filled it, but it was never adjusted.
Correct. You're correct.
Yeah.
So can I clear up the confusion? So we have 6 vacant positions. Right. Yeah, so the confusion, because OPM is who approves our justifications and requests for filling a position. What the confusion is that at one point we had the 91 positions that had been appropriated, but we were at 85. It just requires going back, if you could follow this like string, and I'll try to make the string clear. So we had 85 appropriated positions, then 1 position was taken away, and then we went to 84, and then 2 positions were put into the governor's budget, and then we went to 86. And then we were asked about the 7 durational positions that we had been granted to during the time of COVID, because we had written a special application to have those 7. So then if you add 86 and 7, you come to the 93 positions. And then it was supposed to go back 1 to 92, but I think that the budget book never just reflected that. So then when we were putting on our request so we had those 93, right? It should have gone back to 92. And then in addition to that, we have the 7 or 8, the 7, because 2 of them were in the governor's budget and 7 were with appropriations, right? That was the difference in the budget. And so at some point during this budgeting process, I guess in the budget book, is that where the information goes? That additional position was not put back in, but somehow OPM must have believed it was there, or that would not have been approved.
What we will do for the working session is that
Mhm.
we will get an accounting from OPM.
Okay,
And
all
I
right, perfect.
believe part of the issue is the fact that durationals are not considered part of the budget. We have durationals in a lot of agencies, but these are full-time employee positions here. so
Correct.
Right,
That's part
right.
of, that's part of the confusion. So
Correct.
let's move on so that, because I'm
Okay.
looking at time.
Right.
Okay. Representative Nolan.
Good morning.
Good
Thank you,
morning.
Madam Chair. I talked to you last week.
Yeah.
And I didn't ask a couple questions, and you just talked recently about the funding that you're doing.
Yes.
So could you just share with everybody listening, how is that funding going to enhance commission's ability to process and resolve discrimination complaints more efficiently?
So we currently are dual filing complaints with the state government as well as the federal government. We file under our state statutes as well as the federal statutes, and we assist the Equal Employment Opportunity Commission as well as HUD in the processing of their complaints. We recently have received an influx of complaints from them over the past year, and we anticipate receiving probably double that amount this year due to their reduced employment. They're reducing their staff nationwide, and they rely heavily on the state agencies to assist them throughout the country. And so that's going to put a heavy burden on our state coffers and able to, meet all the needs.
Okay, and last question would be, we talked about a lot of people not understanding and knowing how to reach out or how to make complaints. What initiatives are going to be made this year from here on to make sure that we can market what your agency does and get it out there?
So we continue to have a very robust social media campaign, as well as we're working with the state of Connecticut. We're already on the Connecticut business website. We have direct links from the Connecticut business website to our website so that people can readily access our services. Our website is completely flushed with all of the information you need to file a complaint. All the information on the statutes, the regulations, the different departments, all of the information on our commissioners. We readily go out into all the communities. Everyone in our agency is responsible for enforcing our mission. And so we rely heavily on our regional offices and every unit to utilize our staff to deploy them throughout the state. And we're doing that during business hours and well into the evening, each and every day, on the weekends, et cetera.
Can I add too, we're in the midst of a Civil Rights Unites tour. So it's going to be all across the state, our Civil Rights Unites tour. And we're rolling out the disparity study and what's happening, what the findings were with respect to the disparity study. We're also talking about all of the services that are available at the commission. We are working with partners, the Connecticut Racial Profiling Prohibition Commission. We do panel discussions with them. We're working with the ACLU. We have joined we're not on their panel, but we're out in the audience and we're answering questions and so forth. So we're making sure that we are everywhere. We're also working on social justice films and public service announcements, and we have youth programming. So there are a panoply of things that we're doing to make sure people know.
How many regional offices do you have?
4.
Where are they located?
Hartford, Waterbury, Bridgeport,
And
and Norwich.
And we're also
Okay.
working with the different law schools. We have some workshops coming up at UConn and Quinnipiac. We're just everywhere.
Okay.
Mhm,
Thank you very much, ladies.
mhm.
Representative Lucia. Okay. Representative DiCaprio.
Thank you, Madam Chair. I was just, I was kind of confused as far as with the positions, but I think Representative Walker said we'll work with OPM on that. But I just wanted to just understand a little better you say the additional resources you need because you anticipate more complaints. Is that right?
Well, we're receiving more complaints and we're anticipating more. And HUD has just been gutted. And there are talks about gutting it even further. And HUD is the Housing and Urban Development. And so when the federal agencies get gutted, what happens is that individuals who would file a HUD first complaint, they're just going to come straight to the CHRO and they're going to file with us. And they have started doing that already. Or when there's a distrust in the federal government, then people come directly to the state because that we're here and our services are available to them. Additionally, with the EEOC, which is the Equal Employment Opportunity Commission, there are these projected cuts and guts that are happening. It's not a conjecture; it's already started. So we don't assume we
Okay.
know.
Can I ask, so, do you keep track of all the number of complaints you have and the categories
Yes.
that they are?
Yes.
So would
and-
you please bring, do you have at least the last 2 years?
Yes,
Yeah.
Okay, so that we can see if
they're also
where the
published
spikes
on our
are.
website.
Oh, you know how many websites we gotta read?
We'll
Okay.
bring it to you.
So it helps if it's compact with your
Yes,
material, so
yes,
then it goes into my
absolutely.
book.
Yes,
No,
and
just
we have the
help me.
inquiries too. We
Mhm,
have the
mhm.
inquiries and the complaints that are filed. So
Okay.
it's the increase in inquiries, which is why we need additional intake people. And then
Okay.
it's the increase in the number of complaints that are filed. So those two things coupled together can really bring us to our knees. But if we have the assistance that we're
Yep.
requesting, then we'll thrive.
Cheryl, we got that point.
All
Yeah.
right.
If I could
That's,
pick
that,
on
I mean, that, thank you, thank
Wait.
you for that. I mean, and those statistics would be very helpful. And thank you, Madam Chair.
You're welcome. Thank you.
If I could add to that response, we also requested regarding the need for additional clerical assistance. As Cheryl
Mhm.
mentioned earlier, we usually spend about 225,000 a year in overtime. A lot of that is heavily burdened on our clerical staff, and that's not sustainable. We really need additional assistance
Okay,
in
so
that area.
what we'd also like is a clarification of what positions you have
Okay,
and what positions you feel you need, okay?
okay.
And we can go. Are there any other, Senator? Any questions? No? Representative? No? Representative Nucky? No? Okay. All right. Sorry, I just, we're behind and
Thank you.
we got to move through. So thank you very
thank you.
much. And just bring us those reports
We will.
and bring us your staffing. And then we'll ask OFA and OPM to match up with that. Okay?
Okay,
Thank you.
Thank you.
Okay, have a good day. Thanks,
You
ladies.
too.
Happy Valentine's Day. Yes, we are with our loved ones. Yes. Next, we have Department of Consumer Protection. Hey. Okay, Maureen, you know the drill. Good to see you. Good to see you.
Good morning.
You don't have to read your report.
Okay,
Yeah.
you want me to summarize it a little
Yes,
bit?
ma'am. That would
Okay.
be awesome.
All right, so good morning, everybody. Thank you I'm Maureen Magnan. I'm the Deputy Commissioner from the Department of Consumer Protection. Our Commissioner, Brian Caffarelli, is testifying right now in general law, so we split up and you get me. So since we last met with you, we had a busy year. The agency has operationalized new license types and registrations enacted last session. We oversaw the launch of iLottery in new retail sports wagering facilities in Bridgeport and Norwalk. We implemented enhanced liquor compliance checks through state and private partnerships to deter underage consumption. And we returned well over $8 million to consumers through our guarantee funds and lemon law program. The Governor Lamont's proposed budget does provide DCP with the resources necessary to continue our work regulating and ensuring fair marketplaces for consumers and businesses. In this budget, you will see funding to support the establishment of a prescription drug importation program. This will allow our agency to lay the groundwork to bring Canada's lower cost drugs into the state. The governor's budget provides additional resources for the department's existing oversight of the homemaker companion agencies. The governor's budget also includes an increase to fund 2 new positions to enforce the Connecticut Junk Feed Prevention Act. That's Senate Bill 1248. This legislation will protect consumers from companies that fail to disclose hidden or junk fees in an advertisement, display, or offer for a product or service. The governor's bill also protects consumers from auto renewal by building off the Federal Trade Commission's recent click-to-cancel rule. Companies have made signing up for services or free trials so easy, but oftentimes canceling those services prove rather difficult. We look forward to continuing our work with the governor, our sister agencies, and all of you in the legislative branch to achieve these goals. Thank you again for the opportunity to appear before you this morning, and I'm happy to take any questions you may have.
Thank you. Thank you for that summation. First of all, your head count right now is at 220?
That is the statutory number that we have, but we actually have 182,
182.
right, based on, and 12 vacancies. And that's based on our PS line and what we can absorb.
Okay, and the cannabis
Mhm.
regulatory, that you're losing 62. That's going,
It's the cannabis fund, positions are moving from the cannabis fund into the general fund.
but they're staying within your agency.
Yes.
Okay.
Mhm.
Okay. Very quickly, I know this is part of a question I'm going to ask. Cannabis has different rules of operation for hours than alcohol?
Yeah, the alcohol regulations and the cannabis regulations do not align. So yes, they can be open on some holidays where liquor stores can't. And things
And
like
they
that.
can be open late.
Yes. Mhm.
Did we ever think about making them parallel?
We haven't proposed that, but we would certainly be open to discussing it because it is an odd discrepancy, especially.
It's an
the
odd
holiday
discrepancy,
stuff.
but especially because the cannabis facilities or dispensaries
Mhm.
are open till late as 1 and 2
Mhm.
o'clock in the morning. And a lot of them are in neighborhoods.
Yeah.
And to me, I think that, that's something that we really need to look at.
Mhm.
And I'm getting a lot of complaints from my constituents in New Haven. And I mean, for regulations purposes, I think we have two industries that should mirror each other because they sort of have the same not the same, well, probably close to the same populations that they're serving
Yeah.
and making sure that they are in that. I just had to get that off because
Yeah, I don't disagree with you,
yeah,
Representative.
I mean, I was coming home from the General Assembly, and as I'm coming home, the smoke shop that was right off the exit there at 2 o'clock in the morning was open, it had the lights out and everything. It was like, really? So, okay.
Okay.
Now well, questions. Let me not clog the questions first. Questions? Yes. Hi,
Thank you.
Senator.
Hey.
Happy Valentine's Day.
You as well. I like
Thank
your red.
Oh, thank you.
Good to see you, Maureen.
Oh, Senator.
Question for you about the transferring of the cannabis costs into the general fund. What's the argument for that? Why does the administration want to do that?
The administration wants to do it because we would like to get all of like the cannabis functions into, to match where the revenues are going, and the revenues are going into the general fund. So we would like to the OPM would like the positions to mirror that. Does that make sense? It'll be easier, I think, to track and capture all the expenditures that are being made on cannabis, because it's not just our agency that has positions. So.
Yep. finished? Okay. Question,
Mhm.
does alcohol do that? Do we have inspectors and everything for alcohol?
Yep.
Oversight, and
We have-
they're out of the general fund?
Yes, we have liquor control agents out of the general fund, yes.
Okay,
Mhm.
all right. Representative Nolan?
I thought originally when we put together that cannabis fund, that we agreed to keep it separate just because we wanted to know
Mhm.
how the fund's doing outside of the general fund. And it just seems like now we're gonna combine them, and it just seems like it's gonna be more work to try and understand and find out the information about the fund.
I think I wasn't here when that decision was made to split the two, but I think now that we've had a few years under our belt and some experience with the fund, I don't think it would harm anything to move it into the general fund.
And in regards to the licensing process, how could you explain how the department will ensure the improved license process maintains those high standards and become more efficient?
Which are you talking about? Our general licensing process? We have done a lot of work to put things online and to really simplify the process. So people, when they're applying for the licenses, it's a much easier process to walk through. They can do it online. It doesn't have to be paper anymore. They can pay online. So we're doing that. And one of the things we're very excited about is coming up with digital licenses for our trades so that they'll be able to show you on their phone their license. There'll be a QR code where you as the consumer can then click on the QR code and it will show that the person is indeed licensed with the department.
Thank you, Madam Chair.
Thank
you.
you. Representative Lucia.
Thank you. So, sorry, I was wondering if you could elaborate a little bit on the funding for the Homemaker Companion Agency oversight, because you guys are already doing oversight of this area, correct?
Yes, we are. Right now we have two special investigators and this would add a third. The number of agencies has just ballooned over the last few years. So having the extra person would allow us to do more audits and more response to complaints that we get from consumers.
Okay. And on your current services to adjust the current requirements, I noticed they're taking 1.6 million out of your PS. Do you know what your current lapse is?
Yes. One moment, please. Our general fund PS lapse is $1.3 million.
Okay, so it's 1.3 million right now.
Yes.
So they're basically removing 100% plus of your lapse. Do you feel
Mhm.
like that's?
We feel based on our head count and that we can handle this and absorb this reduction.
Okay. And then I think that's all I have right now. Thank you.
Thank you. Representative DiCaprio.
Thank you, Madam Chair. I just have a question regarding the Canadian prescription drug program. Can you explain, is there consultant costs with that program?
Yes, in the first year in the OE, there's $100,000 for a consultant.
Okay, in just the first year only?
Yes.
Okay, thank you very much for that. Thank you, Madam Chair.
Thank you. Are there any other questions from any members? Okay, so, so let's go back to the cannabis.
Okay.
The personnel services that you have are the 62 positions. Can you just refresh my memory? What are those positions for? Is that inspectors?
We have drug control agents, and that's the bulk of it, but we
Okay.
also have a core group of, we call them like health associates who do a lot of research and check on make sure that the cannabis is properly tested. So we have a lot of oversight into the testing and the packaging and things like that as well.
Okay, so is this the original number of inspectors that you started when we first?
Yes.
It is, okay. And at this time, you feel that that is an adequate number of people in the cannabis industry?
You know, we do, but to be fair, this is still a very new program.
Mhm.
We're still, we've hired up as much as we can, but people are still, you know, leaving for other jobs, getting promoted, things like that. So we're kind of constantly refilling there. But for now, yes. And, you know, as the program grows and we have other lotteries and expand, we might come back to you, but not this biennium.
What is the current revenue that we acquire through the cannabis sales? Do you remember? Do you know?
Uh, um, the total number of sales for cannabis?
Mhm.
It's since the program started in January 2023, it's $591 million.
Since, okay, so what was the last amount for last year?
In January, it was 23 million.
It was 23 million.
Mhm.
So the expense here is 5.6 million. Are there other locations in the budget that cover the expenses besides the fund? Are there other locations in the budget that cover expenses for cannabis, like DPH, things like that?
Oh, you mean other agencies?
Yes, I'm sorry.
Yeah, I think DPH, Demus, I can get you the full list.
Okay, I'd like to know how much money each one of the, I can find out. I think
Okay.
I'd like to find out from OFA, a breakdown on the
Okay.
cannabis, who gets money from the cannabis fund and what is the revenue that we're getting
Okay.
in that, and trying to understand it a little bit more.
And by the way, those numbers I gave you are adult use and medical combined.
Ah, okay, okay, all right. But the regulation on medical is different than the regulation on adult
A
use.
little bit, we actually are spending time trying to merge them together a little bit within our regulations.
Has has the amount requested off of medical marijuana dropped since we regulated it?
The number of patients has, yes.
It has,
Mhm.
okay. Do you know what it has dropped? What
Uh,
percentage?
Can get you that number. I don't have it
Okay,
off the top of my
okay.
head.
Transfer funding for software to DAS, you are now going to be part of the IT
Yeah,
empire?
right. And that we already are staffed by DAS employees, so this is just a natural next step.
How many staff people are you sending? Or,
This is, we're not sending, in this case, we're not sending any staff. This is just a contract for our prescription drug monitoring program that will go over to them. An existing contract.
I'm sorry, you're not contracting for personnel.
No, it's a software system.
It's just,
Not
you-
yet.
so you're spending $694,000 for just software?
Well, it's for the whole program to allow the practitioners to go in, register what they're doing, and then we can keep track of who's prescribing what to whom in an effort to fight the opioid crisis. Yeah,
Yeah, that's why I went, so it's going to DAS.
Yeah.
We had DAS already. That I did not understand. I mean, that I don't understand how they do
I
that.
can
Okay,
get you more information on exactly what the company does if you'd like.
okay, this is a contract.
Yep.
And the company is
Bamboo.
Bamboo?
Yep.
I don't understand the connection. College days, college days. Okay. All right, let's see. You're providing funding for homemaker companion agency oversight,
Right. Mhm.
and this is this is a new position for you.
Yes, this would be adding a special investigator to our division that audits and inspects the homes. Excuse me, the agencies.
The agencies. What authority do you have for that? Because you're oversight of your consumer.
Yeah.
So let's say you go out and you find out that there's a violation. Do you give them the violation, or does DSS do it, or who?
It really depends on the complaint and the findings. If it's something that we discover they're doing outside their scope, we would turn it over to DPH.
Okay.
But if it's a complaint about like abuse or neglect, then we would work with law enforcement.
So, and one staff member is going to oversee 1,000.
Well, we already have two, so this would be three.
Oh, shoot the moon. I mean, having gone through the issues that we went through after COVID
Mhm.
with the agencies, the nursing homes and things like that, there were so many things that were going on that,
Yeah.
I mean, I welcome the help and the additional oversight, but are we really getting to the heart of it with just three people? It was a lot. And we had a lot of people testifying over and over again about the actions of some of the facilities. So, okay. Okay, all right. I guess that is it. You have OE on that. Now I know what that is. Okay, so that's fine. Yep. Thank you.
All right, thank you so much.
Thanks.
Good to
Have a
see
good day.
everybody.
Thanks. Good to see you.
See if they can- the overtime one.
Oh, I'm sorry. One quick question. Did you have overtime?
We have a little bit of overtime, like 15,000. Yeah. We have a very small overtime, about $15,000.
Oh, okay. All right, cool. Thanks. Happy Valentine's Day. Hmm?
I want to
Let
know
me-
that because that would determine whether or not they need more positions.
Yeah.
15,000.
Let's see. Is the Office of Healthcare Advocate here? Yes. Ah, over there. Hello. Good morning. Happy Valentine's Day. Thank you. Gotta look for those happy clouds every once in a while, yeah. Would you like to make a statement or would you? Yep, press the red button. There you go.
All right, thank you so much. Senator Slapp, Representative Nolan, Senator Gordon, Representative DiCaprio, and members of the Appropriations Regulation and Protection Subcommittee. I'm Kathy Holt. I'm the acting healthcare advocate for the state of Connecticut. And with me today is the Office of the Healthcare Advocate General Counsel and most recent previous acting healthcare advocate, Sean King. Thank you for the opportunity to speak with you today. The Office of the Healthcare Advocate has been an independent state agency for 25 years. We help Connecticut consumers understand their rights and responsibilities as members of all types of health insurance plans, and we represent consumers in health insurance disputes at no cost to them. Our highly experienced staff of 19 attorneys, nurse consultants, paralegals, and consumer information representatives often intervene directly on behalf of individual consumers to resolve insurance coverage disputes through administrative appeal processes, saving consumers over $6 million in 2024 with our operating budget of about $4 million. We consistently win insurance disputes for consumers 70 to 80% of the time. For another 40% of consumers to whom we provide solely guidance and education, but no direct service on their behalf to resolve problems, we give unquantifiable but valuable direction and assistance to resolve their health insurance concerns. Also, our expenses and data gathered through about 5,000 annual consumers allows our agency to share valuable, informed healthcare cost, coverage, and quality trends and patterns with legislators, regulators, and insurers, and to collaborate fully with other health-related state and national agencies and partners to identify systemic problems that consumers face while accessing and paying for healthcare, and we propose solutions to those problems. Our full staff complement is currently budgeted for 19 full-time employees. One of those positions is occupied by the state cannabis ombudsman, and another of those positions was recently vacated by a senior attorney, which we are seeking urgently to fill. Of the remaining 17 staff, 15 are currently engaged in overcapacity assistance for increasingly complex individual case management. A 16th person gathers and reports out data, and then there's me, the acting healthcare advocate, 4 months into my position, appreciating how much of a real difference we make, knowing with more outreach, education, self-help materials, and awareness to Connecticut consumers, we could help more people than we currently serve, both individually and systemically. And knowing that if we overhauled our imperfect case and data management system by having a skilled programmer and health data analyst, we could achieve much more effective results, perform better data analysis on the valuable information we gather, and serve more consumers effectively and efficiently, individually and systemically. We currently anticipate increased outreach through a new communication and marketing campaign we are developing to improve our agency's service delivery capacity and effectiveness. To support this progress, we request funding for 2 additional staff positions to help with this outreach and education production, the inevitability of more consumers to serve, case management system modernization, and critical data analysis. Aside from our current mission work, which I've described, the governor's budget proposes transferring the Office of the Behavioral Healthcare Advocate into the Office of the Healthcare Advocate. This is a new agency yet to fully form, but with a non-consumer focused mission. To be clear, the Office of the Healthcare Advocate is already serving consumers with every type of healthcare issue, physical, mental, and behavioral health. The Office of the Behavioral Healthcare Advocate's mission, primarily to serve providers, is very different than our mission, which focuses on and serves consumers. The newly formed Office of the Behavioral Healthcare Advocate's 6-member advisory committee appears to be made up solely of provider representatives, whereas our advisory committee has broader representation on behalf of consumers. While the Office of the Healthcare Advocate and the Office of the Behavioral Healthcare Advocate missions may align at times, at other times, critically, the interests of consumers and providers will conflict. For this reason, we believe our consumer-focused agency should not be serving the interests of both consumers and providers. Also, our consumer information representatives would struggle to pivot between helping consumers and helping providers. The budget proposal reduces the previously contemplated Office of the Behavioral Healthcare Advocate staff of 4 people down to 1. Whether the Office of the Behavioral Healthcare Advocate requires 4 or 1 person to perform its statutory mission is not for our agency to determine, but we do not have the statutory mission directive to serve and represent providers. Finally, on this issue, in order to avoid further consumer confusion about which agency they should be contacting for consumer assistance, the acting healthcare advocate invites the behavioral healthcare advocate to be renamed as the behavioral healthcare provider advocate. Just a few words on the potential budget impact of proposed Senate Bill 1192, an act concerning hospital financial assistance. If enacted, this bill seeks to leverage the resources and expertise of the Office of the Healthcare Advocate to help consumers better access financial assistance programs offered by Connecticut's hospitals and health systems. Specifically, the proposal contemplates a partnership between our agency and Connecticut hospitals to help facilitate a process that will reduce the significant burden of medical debt on consumers. The Office of the Healthcare Advocate welcomes the opportunity to collaborate with Connecticut's hospitals. Given our consumer-driven mission, it makes sense for us to host the information. But consumers are invariably going to call or email us with their questions or other follow-up needs about the financial assistance programs. And our small staff is currently at capacity, responding to direct service insurance issues and too strapped to manage financial assistance application needs. Additional Office of the Healthcare Advocate responsibilities contemplated by the bill, recommending initiatives to avoid medical debt or methods to streamline the application process for hospital assistance programs, are both desperately needed functions for consumers. We would be happy to expand our assistance to provide those functions if we had additional staff, a person or two, to perform those duties that require a different financial skill set than we currently have. However, in the short term, to the extent that Senate Bill 1192 envisions the engagement of a vendor to assist us with the development and maintenance of online tools and referrals to hospital financial assistance programs, we would also welcome an appropriation to cover necessary vendor build-out expenses. Finally, about our longstanding funding source, the budget of the Office of the Healthcare Advocate is funded by assessments on insurance companies regulated in Connecticut. There is a clear nexus between healthcare insurers and the Office of the Healthcare Advocate. We provide education and information to individuals about their health insurance coverage. We manage plan and policy administrative corrections, and that we identify mistakes the health insurance companies make when they deny services or claims that should be rightly covered. We work with health insurance companies to make the process better for consumers, health plans, and health delivery and payment systems in Connecticut. Assessments on healthcare insurance companies should continue to be the appropriate funding source for the work and the mission of our agency. Concluding, on behalf of the Office of the Healthcare Advocate staff, we are very proud of our record of successfully resolving disputes, maintaining a high level of consumer satisfaction, and providing high value in financial returns that far exceed their annual investment. Thank you for the opportunity to discuss our budget and operations in greater detail and to hear our concerns about managing future volumes and new responsibilities. Sean and I look forward to answering any questions you may have for us. Thank you.
Thank you. Thank you for your testimony. Sounds like they just created the advocate agency. It doesn't matter whether it's for consumer, for provider, for banks, for whomever. Interesting. And hospitals. I forgot about hospitals. Let's start with the behavioral health advocate. The recommendation that they become part of your organization came from where?
We learned about it this week when we saw, last week.
When you
I'm
saw
sorry,
the budget.
When we saw the budget, correct,
So this is a governor's recommendation.
correct.
Okay, all right. And in asking about that, was there any other explanation except for the fact that you both have advocate in your name?
I would say, and this would just be speculation on my part, that the governor's office thought that this ombudsman, the advocate would be a function that we are not currently performing for consumers, and that this, because well, let me just say, when I first saw that there would be an Office of the Behavioral Health Ombudsman, I thought, well, you can't split people up. You can't say, we'll take your physical or your mental health issues over here, and then we'll transfer you. So it was confusing to us. And I would let Sean participate in this conversation because he's been involved in it much more closely than I have.
It sounds like they're trying to create another Office of Government Accountability by throwing all the potential agencies in one pot and having them spin off. But go ahead. I'm sorry.
Just to kind of build on that, my understanding of the origin of the Office of the Behavioral Health Advocate was that there was perceived to be some need for the voice of mental health providers, in particular smaller mental health providers who at the time, and this was legislation that was just 2 years ago enacted. And so this new office was created so that there would be a voice for that small mental health provider community to assist them in trying to resolve problems that they were having with insurers primarily.
Okay.
As Kathy mentioned, as the voice of the consumer, we would sometimes assist in those cases where interests were aligned, but in some cases, interests are not aligned between the patient and the provider. Sometimes financially, sometimes for other reasons, but so we would have to defer assisting that particular provider complaint if we thought there was a conflict with the consumer's interest.
I thought it was for the consumer. That's why I'm sort of confused, because I know that's something that came about through the mental health organization, TCB, that the consumers needed someplace to go to be able to talk about their circumstances of trying to access services. I did not know that they were doing it for the providers. That was not my understanding.
Yeah,
Because,
OHA has always been available to consumers, to folks who are trying to get access to mental health services and trying to get coverage of mental health services. We've always,
so you have
assisted those
performed
consumers.
that responsibility.
yes,
Okay. And that's in your definition.
that's correct.
Interesting. Okay. And then the other one that was put in there, the hospital. And the purpose of the hospital was for the consumer?
Correct. Yes.
Okay.
Apparently there has been, for different hospitals, there's been different pathways
Mhm.
to find information. I will say with regard to that, one of the things where I think we could actually do more work is it to make sure that before someone needs an application for medical debt, or if they have filled out an application, that we in the Office of the Healthcare Advocate will exhaust all the appeal remedies for individuals. Because if insurance companies should be paying, then the medical debt piece should be lowered. So we need to look more into how we would coordinate all those activities. But having that one place where people can go to obtain any application for any hospital is seen to be helpful for the consumer.
I understand the value of it being in your office, because people do have medical debt that has created major problems, and that's the whole point of the advocacy organization that you're doing, is trying to help us navigate those systems. The provider one for mental health still stumps me. I'm very confused about that. Okay. Yes, Senator Austin.
Thank you. So first, I want to thank your organization and the healthcare advocate role that you cover. It is my go-to and my staff's go-to for any problems that have to do with physical or mental health broadly. You have, in my opinion, saved a whole host of angst for people that had nowhere else to turn. And so I think that this is an office that I am pleased always to provide the funding for. You do a lot of work with very little resources. I happen to have been involved in the behavioral health advocate, so I'm going to go back to the original purveyors of this to find out what they intended relative to this. I think that this is being done as a cost savings measure by the administration to what Representative Walker was intimating was a consolidation of services. And that's where I see this is going. But I can't thank you enough for the hard work that you and your agency broadly does for people every day, and to give people a sense of actually being able to figure something out for healthcare for them or their families is life-changing for people. So I can't thank you enough for that. And I'll go back and work on the behavioral health and see what we're doing here, because I need to get to the bottom of understanding whether we want it combined or whether we still want it to be a standalone agency. So thank you. Thank you, Madam Chair.
Thank you, Representative Chia.
Thank you, Madam Chair. So if I'm reading here, what's in the book, it's two parts. So the first part was assisting mental and behavioral health care providers with receiving payments for claims submitted to health carriers for services provided to cover patients. So that's kind of similar to what you're doing, but it's the provider looking for their payment. And then the second part is assist residents with accessing mental and behavioral health care and related resources. So you said you are already doing number 2,
Mhm.
right? Okay, so the first part is the one you would be working with providers, the same thing for people, but like they're not getting paid for their claims. So it'd be working with the providers to get paid for their claims, correct?
Yeah, that's correct. I would say on that it's a slippery slope because there are a lot of providers in the world. And as it is, we get calls now from providers wanting us to intervene. When we can do so on behalf of consumers, we will. If it's for the convenience of the provider, we just don't have the resources in order to do that.
Right, I think that was kind of the purpose of the transferring the one person over to do that. That's how I'm reading it anyway. But then I guess that kind of leads me to the positive testimony you had for SB 1192. That would be working directly with the hospitals. So that's working directly with a provider.
For the on purely for the consumer benefit, for to avoid medical debt. So
Right.
we would not, yes, there would be an advantageous outcome for
The provider,
hospitals that
right.
would get more money. But the initial importance of that is for the actual consumer.
Yeah, I guess I don't really see a massive difference between the two. Like if the mental health provider is not getting paid and they call you rather than I call you and say, that my insurance company is not paying this, or the provider calls you and says the insurance company is not paying this, it's still going back to the consumer not paying, not having to pay it out of pocket because it's been denied.
Right. I don't think it's necessarily a question of payment. With the Office of the Behavioral Healthcare Advocate, that would be someone who would be working on the rates that the providers would get to make sure that they were properly compensated. That's not something that
Yeah.
our agency,
I think Kathy needs to go back and
participate in.
confirm that because that's not what this says. It's specifically talking about PA 23101, where it says, number 1 is providers, assisting providers with receiving payments for claims submitted to health carriers for services provided to covered patients. So I think we definitely need to clarify that because again, that sounds like has nothing to do with rates. It just
Right.
has to do with we're not getting paid or they clawed back something or now, it's falling back on the client. So I think some clarification on that. I don't necessarily think this is crazy, especially if they're going to transfer a head over to take care of that one piece, but I think we definitely need clarification.
Yeah, I appreciate that. I'm not sure where the 4 people originally, someone originally thought there should be 4 people to do whatever that task was.
Yeah,
And I would also say that we do want to help consumers. It's more a matter of making sure that this clarification is made.
yeah. And then the only other question that I have is you mentioned one of your heads was the state cannabis ombudsman,
Correct.
and that's in your general fund. It's not in the cannabis fund, which I think is odd. Do you know why that transpired that way? Because everything else cannabis is in the cannabis
Cannabis fund.
funding.
Mhm.
I don't know if I can provide a full background, but
Good luck if you can.
there was some rationale for putting the cannabis ombudsperson within our office for administrative purposes, and those administrative purposes are, essentially to assist with, because this person is out there advocating for medical cannabis patients. She's not an expert on state fiscal, payroll, anything like that. So we provide through the Department of Insurance, who provides a lot of administrative functions for us. We assist her with those administrative duties of just, making sure she gets on her payroll and that sort of thing. So, so that's why it's in our budget, is so we can facilitate just using that money and getting it distributed where it needs to go. As far as the history of why the cannabis ombudsperson is within our office, my understanding is there was a desire for some level of independence from the Department of Consumer Protection or some other agency. So when that was created, it was looking for a home that was a little more independent from other regulatory agencies. But that's about all I can say to that.
That's helpful. If you could just bring to the work group when that was established, like was it established before recreational marijuana passed? Like and what the total dollar amount that you're expending for the ombudsman, that'd be great.
It's her
The-
salary, I'm sorry.
Oh, I'm sorry. The cannabis ombudsman was created in 2003,
Okay, so
That's
because
from
it's
the
for the
Office of
medical,
Trade.
right?
Yep.
It's specifically for the medical, right?
specifically for medical,
Okay.
right? The budget.
I
bear
believe
with me.
it's her salary plus $15,000 that is used for,
Part of the
Or-
clerical.
yeah, clerical
expenses.
issues.
Okay. That's helpful, because that's what, as you were talking, I was thinking that it was probably more the medical marijuana and not the recreational, which is probably why it's there and outside of the cannabis fund. All right, that's all that I have now. Thank you.
Thank you. Representative McCarthy Vahey, maybe we're going to find out where the bill came from.
Thank you, Madam Chair, and forgive me for being off camera. I want to thank the leadership from the Office of Health Advocate, and thank you for your positive reception of the Hospital Financial Assistance Bill, a bill that we actually passed out of the House last year and are hoping to start in the Senate this year and pass through. And I just want to underscore the comments that this really is a bill about consumers. What we're doing is asking the hospitals to provide information to the Office of the Healthcare Advocate so that consumers can more easily access that. And I would welcome the opportunity to talk further with you about the staffing issues, which is a conversation we haven't had as directly to date. So I'm glad to be back here on the Appropriations Committee. This is the good part of that. And certainly want to make sure that, as the chairs have indicated, we can help alleviate or improve the burden of medical debt on our constituents. So I just emphasize the consumer aspect of it as well. And I look forward to connecting. And thank you, Madam Chair, for the opportunity to make those comments.
Thank you, ma'am. So I think all of us are the mental health behavioral advocate was from what bill, did you say? Did you say that?
I'm sorry, I don't recall an exact bill
Oh,
number.
oh.
It was from the 2023 session.
Oh, it's PA 20, okay, so that passed in 23. I'm really confused too, because you go to do a great job for advocacy for our consumers out there. And it's really important that there's a security in people reaching out to you to get information and get help. I think we need to find out a little bit more about the behavioral health ombudsman or whatever, advocate, because it's really for the provider. And I think you have, let me ask you this. How many cases do you address for mental health issues as an advocate for consumers?
I don't have that number at my fingertips, but
Mhm.
if we're here for a few more minutes, I might be able to find it for you.
Okay, you could bring it to our working group, because I think if we were really looking at this, I would prefer having somebody help you with the advocacy for mental health for the consumer in your agency. And we try and find this placement for this advocate in another area. I think it's counterproductive. It's kind of sort of like, I know we have DCF, who is, a provider, parent as a foster care, and then they also separate. So we have a confusion there about what the role of DCF is. But I think for advocacy purposes, this is really something that I think is important, because you have such a good, outstanding reputation out in the community, and people really feel they're getting the help that they want from government. And I want it to sort of stay that way. So
Thank
are
you.
there any other questions? Any other questions?
I would just add to
Sure.
the question that you just had asked about how many mental health cases we have and behavioral health, that a number of the calls that we get are about prescription drugs as well. So there, we can go back and parse through all the different categories of questions that we receive and make sure that we can answer that appropriately.
Can you give us just a quick example of when you say prescription drugs, what type of help are they seeking from you? Information or?
Where they are trying to get coverage typically for
okay.
medications
Yeah.
that for whatever reason, they have been denied or they need an exception to a formulary request, something like that.
So the core is the insurance company. The core is because they're being denied services from the
Correct.
insurance company. The hospital one is the insurance company,
Correct.
but the ombudsman for mental health is not, correct?
That's what we'd love to really understand better.
Okay.
We certainly want to serve the consumer, but we want the consumer to know that we are the consumer reports of, we don't take advertisements, we are purely consumer focused.
Thank you so much. Thank you. There, no more questions. Thank you very much. And we look forward to talking to you in our work group because it's going to be a lot of work. So thank you and have a good afternoon and happy Valentine's Day.
Thank you.
Thank
as
you.
well.
Okay. I'm going to pause for a few minutes because we're running a little ahead of schedule. I want everybody to please note that when I chair the meetings, we run ahead. I don't get into a long litany. Where is she? So we'll take a pause for about 10 minutes. Thank you. Oh, she's back. Well, okay. I was going to pause since you weren't here.
No, I'm here.
Okay.
I'm sorry.
That's all right.
I had to walk down and walk back up
Okay.
because I'm refusing to use the people movers.
Okay. The insurance department. Okay, we're ready. You can come on up. Let me go figure out where I'm going. Okay.
Good morning. Commissioner, the floor is yours. You want to say a few words to start? You can go ahead.
Senator Slapp, Senator Austin, I know Representative Walker just stepped out for a second, Representative Nuccio, Representative Delnicki, and I think I heard Representative McCarthy Vahey was on the line, so I would like to say hello to you, to all the members of the Regulation and Protection Subcommittee, and I am going to make Representative Walker happy by keeping this very brief. I'm Andrew Mays. I'm Commissioner of the Connecticut Insurance Department, and I'm here in support of House Bill 6864, which is an act concerning the state budget. The mission of our department is, and always has been, always will be, consumer protection. We ensure insurance companies follow the state's laws and treat policyholders fairly. We offer guidance, support, and education, and regulate the industry in a way that promotes competition in the marketplace so that insurance is available for everyone. This session, our agency bills do not contain any need for increased funding, and we fully support the governor's proposed budget. And with that, I'm open to any questions from the committee.
So first, I want to thank your department and the people they have with you that participated in the insurance fund task force. I think that I won't speak for anybody else, but I certainly got a lot of information out of the task force that I can't. Insurance fund is very complicated. Insurance is a very complicated, I think, but I was dragged into this kicking and screaming. And so learned an awful lot, and I would encourage people who did not read the report out of the task force to actually look at it because it outlines the different things that are going on within the confines of the insurance fund and how and what is actually funded out of it. I think that that's important to know. So I just wanted to thank your staff for really giving us the knowledge that I think was necessary for us to come up with a decent report there.
Thank you. I will convey that to Assistant Commissioner Lombardo and everyone who participated. I know nobody wants to talk about insurance, so it's always great when we can share the information. We just love talking about it.
And also, to that end, we talked about you talked about affordable insurance.
Mhm.
And I'm finding more and more that insurance broadly, whether it's property and liability or healthcare, is becoming increasingly difficult to afford, just based on the uh, complications of what is actually covered and what is going on. So let's talk a little bit about property and liability first. So property and liability seems to be going up exponentially, and I don't know that it's necessarily as much to do with our insurance fund complications that we have, but market and problems that are happening across the country. So we had the fires out in California, we have floods that happen, we in North Carolina, we had a host of different storms that have led to complications. Where do you see the market going for property and liability?
I wish I had great news. I'm going to be frank with you. I'm not necessarily sure I do. Let me start off by saying that all of the rate increase requests we review, we go over them to make sure they're actually justified, and so that they are not unfairly discriminatory, they're not excessive, and they can support the solvency of the company. As you know, the insurance department, all insurance regulators, we have a role, a dual role, as we work to protect consumers. There's market conduct and solvency, making sure the company has the ability to pay the bills, making sure the company has a willingness to pay the bills. The flip side of that is that the premiums that are charged should accurately reflect the risk. And what we have seen, certainly over the past few years, and I would go back, especially with property casualty, we're going to go back to the COVID years and then to certain geopolitical events. We saw significant supply chain disruptions. Okay? From there, those drove up the prices of the materials that are used. And this applies to both auto and homeowners. The prices went up. There was significant inflation in that sector. We have been monitoring it. I will tell you, we call the modelers into the department. We take a look at what they're saying, and we make sure that what they're saying is actually accurate as best as we can determine that it reflects the reality there is. Now, the downside and the sad part is that I'm not necessarily sure, given the uncertainties in the world today, that this tradition of increasing base costs, which in essence determines the premium, will not continue. I'm not going to speculate on what the effect of tariffs might be, for instance, but you can look at any economist. They're all talking about the effect on the broader economy. We also know that a significant portion of the workforce may not necessarily be around. If some of the work that's suggested that our lawmakers in DC do is actually done, that could drive up costs. We saw during the past 3-4 years, we saw the labor costs increase. We may see that go up more. So we're looking at what is close to the perfect storm. We're seeing labor costs increase, and we're seeing the cost of raw material increase. And that drives the cost of coverage. Because what happens is if something happens to your house or your car, doesn't matter what the costs were 5 years ago. If we've got to replace it, then they have to go based on what the costs are now. And they have to make sure, part of what we have to do is to make sure the premium will cover that. There are some things we can do, and there are some things this department will continue to do. We are very focused on education, and we are going to be doing more. That's certainly one of my priorities for this year, as we've seen what's happened. We are trying to make sure consumers have as much information as possible on all aspects of insurance, on life, on health, as well as in property and casualty. We also have to make sure that consumers understand the coverages that they have. So that's one thing we saw last year. The people that were hit largely by the flooding, the unexpected flooding, did not have flood insurance. Now, by and large, flood insurance would be provided nationally, but many people chose to forego it. We want to make sure people understand the risk, because for most people, your house is your single largest investment. It is the way you are going to create wealth. It is the way you are going to transfer wealth across generations. So I think it's incumbent on us to make sure people are aware of the risks that are involved, that they understand the value of that insurance. That doesn't mean that people are going to go out and buy the insurance. That's an individual decision, but we want to make sure everybody is as informed as possible. And the other part of that is in terms of risk mitigation, and this refers more to the effects of climate change. We've all seen the map. We all know that there are an ever-increasing number of natural disasters that are happening in places that we wouldn't expect. You saw the LA fires recently were maybe a spectacular example. But if you just look at what's happening across the country, NOAA has on their website, they have a list of billion-dollar disasters each year. And this is a list that's inflation adjusted, so it's not expanding because of inflation. And you look at the numbers, the curve is going up almost exponentially. Now, what can consumers do for that? Well, it's interesting in that there are relatively simple measures that you can take that will lower the damage that you get. We've all seen the houses, the one house that stood up in the middle of a hurricane because it was constructed to standards. We've all seen the house that survived the fire because it had, they'd gotten rid of essentially all the fuel around it. We want to make sure that consumers are aware of what they can do. We work across boundaries. We've got an advisory, a climate risk advisory council, whatever the formal name is, that we are working on. We're working to make sure the ways that we need to use to get out to consumers, both through, in some senses, regulation or legislation, in terms of making sure that the building codes will meet the standards that we have. And the Insurance Institute for Business and Highway Safety has some great codes that lots of companies follow. But also, what else can we do? How can we ensure that people understand that a dollar that you invest in resiliency measures on your house can save you? You'll get a return of about 11 to 1, 11 to 12 to 1. That's a good investment. But it will require work on the part of the legislature, on the part of the department. And, so far as I see it, it's going to be, or it should be, a public-private partnership. We should all be involved in this because, this is why we have, for instance, academics on my council. This is why we have on my council representatives of industry. Because if you can reduce the probable maximum loss that you're going to get, you should be able to help keep the premiums down. That's one thing we can do. So those are among the
So would you
measures.
do you have the ability to do outreach education on some of this? So for example, many of us do teletown halls that have people that participate in parsing out information in a fashion that is easily understood, not with technical language, but changes that could happen. And relative to flood insurance, areas are flooding that you wouldn't even know would ever flood. If you don't, there might be an historical brook that has never risen up, out of its borders, but the town of Scotland right down the road from my house had 3 bridges or 4 wiped out, and you would have never expected that waterway to do that kind of damage. To be true, the bridges were older, but they had never had the complications of that one storm that created a significant problem and actually kept some houses were actually split off from having the ability to get out of their homes onto a regular road. I mean, they were lucky enough to have somebody let them drive through a cornfield, but that's not optimal, right? And somebody happened to be pregnant and, you don't want them to have to call an ambulance and try to figure out how you're getting a someone in labor out of their house, but I think that that's part of the problem is now you can walk your property and not see some of the possibilities of having a tributary that is close or nearby from wiping out a significant part, like what happened on the western part of the state.
Completely agree with you. And by the way, I will tell you what you mentioned. The staff of the department will share with you. My mantra is make it accessible and usable for consumers, because sometimes, we know the language, we get caught up in it and we don't understand. This is an industry that loves acronyms and we don't necessarily understand that doesn't translate. So we're actually reviewing everything that we have on our website, what we do on social media, to make sure it's accessible, usable information for consumers. So I just wanted, because you mentioned that, I want to touch base on that. In terms of outreach, one of the issues that we faced over the past few years was a number, there have been changes in our workforce. The retirements that were incented by the contract a couple of years ago, and we are working hard. We are close to being fully staffed, but at this point, within the last couple of months, I think it was, we were able to hire one person in consumer affairs that will be primarily dedicated to that in-person outreach, because I think it's important. I mean, we do so much more on social media. We issue so many more consumer alerts than we ever did. But that's for people who are on social media or who, so what we're trying to do and what you will see shortly as we ramp up with this new person, they will get back out to going to the libraries, to the Kiwanis clubs, to the Rotaries. And we are happy, and I extend this to all legislators, we are happy to join you in any town halls, any discussions that you have. We will provide people with the knowledge and expertise in order to do that. The last point I wanted to touch on is in terms of what we in the industry would refer to as a flood mapping. Flood maps with a flood insurance program are determined by FEMA. So they have their maps. And maps were updated. They may not necessarily be state of the art. They may not necessarily be 100% accurate. And, as they say, if it rains, it can flood. One of the things we've been doing in the department over the past few months, and we've had discussions with a number of different providers, is to try to get information that A, is as absolutely up to date and accurate as possible, and B, figure out a way to get that to consumers. My goal would be to have a, part of our website, consumer goes in, you're living someplace or you're thinking of buying someplace, you put the address in, and it gives you this readout that tells you you have a 55% chance of flooding within the next 30 years. Again, it's going back to consumer information, but I do think that is absolutely vital as we move ahead.
And do you do it in different languages too? So if we had an area, would there be an ability to translate some of that information into Spanish or?
We certainly would be. I just can't tell you what's on the website right now,
Right.
but I will tell you that that is something I would fully support. If it is not available, we will get it to you. The documents themselves are relatively easy to get translated, but we would have to get a native or at least a fluent Spanish speaker or any other language for any event.
And so and I could talk a lot about property and liability because I do think that that is something that everybody understands a little. It's a little bit, I don't know whether it's easier to understand, but it seems to be less complicated than healthcare. But I want to talk a little bit about CFSIC, about the crumbling foundations, but the captive insurance market. My understanding is the captive insurance market is growing in Connecticut. Have we done enough to encourage captive insurances to come into Connecticut?
We have done a significant amount. I'm not sure that I could ever define enough, but I do know that working with the legislature, we have made significant changes over the years that I've been here, and it is reflected in the growth of the market. Now, part of what we do here in Connecticut is we are targeting the higher end companies, higher end markets, and we know that there are issues with insurance that with traditional insurance, that so captives can fill in with the capacity there and allow companies also as a side effect to retain some control over their capital. we are fully in favor of that. I think pretty much every year, as we see changes in the market, we send them to the legislature and ask for your approval. And every year, the legislature has responded positively, and we appreciate that. We want to thank you for that. We will keep pushing it. We will keep working on captives, and because I think Connecticut, it takes a while to overcome a reputation. If you had not been doing the outreach, it takes a while. I think we're at a stage where we now have a reputation as a good captive market, and we're going to keep pulling in more of that. We've got the resources to support that market. I work with the Connecticut Captive Insurance Association. I'm going to be a keynote speaker at their next event. But to me, it's important. It was one of those signature items at the start, and I will never be happy with the progress we make, but we keep making progress.
Well, I think that what CIFSIC did, the Crumbling Foundations captive, was one of the most successful use of government in dealing with a problem that we had. It has an end in sight, and which I think is actually a good thing in this particular case, that we have dealt with the problem, both with policy and with actual construction. But I've never been and happened to be an ex officio on that board, but I like being on it because I've also learned so much from that perspective. And I think that if we can get more captive insurances, like maybe we could steal a few companies from Vermont, one or two.
I would be more than happy to get a bunch from Vermont, a bunch from South Carolina.
Let's work together on that. See if we can get some. Representative Nolan.
Yes.
And then, well, I got Representative Nuccio.
Good afternoon.
Good.
You touched on a couple of things, and the senator also asked a couple of things of interest. The FEMA flood maps that you kind of briefly touched on. So FEMA creates the map to say wherever and whatever flooding zones there are. How can we add more zones to what they show? Because of what Senator talked about, there's just so many other places that end up flooding up, and they're not on the zone.
Yeah, my concern is not adding to the zone per se, but adding information about where you are. The flood zones, the real practical implication of being in a flood zone is if your mortgage, you're buying the house, you're taking out a mortgage, and it's going to go to Fannie Mae or Freddie Mac, they are going to require you to get flood insurance. That is the most practical implication of that. And, it also gives you a certain level of information. What we would like to do is to look, and this is what we're working on with these various modelers, First Street Foundation and others, look beyond the flood zone. So flood zones are relatively easy. There's a concern. You may not know how high the concern is, but it may be that your house is good if you're living in a neighborhood, but the house across the street, because it's lower or closer to the creek, is more likely to get flooded. That person, if they have that info available to them, can take the steps to protect that property. That's what we're shooting for. We want to arm consumers. So it's not about the mortgage side. It's about making sure consumers know the risks they face, and that way, it's just like any other. If you know the risk, you can take some steps to address it.
Okay, and you talked in regards to arming consumers. We have a lot of aging population, and it's very difficult for them to get updates or informations because they're not online. How are we reaching out or trying to protect them in regards to some junk mail that's going around, or trying to inform them of what's good and what's not?
Yeah, two separate issues there. I just want to separate them a little bit, because from where I stand, last year I was president of the National Association of Insurance Commissioners, and one of my priorities for the year was improper marketing to consumers. Now, I will tell you, we saw that primarily with the Medicare Advantage plans,
Yeah.
and we don't have authority over those plans. Over the past few years, and every year I go to DC and talk to our representatives or elected officials in DC are always very supportive. There may be others who weren't necessarily as supportive as ours. But what we've wanted, and we've said to CMS, we've said to the federal government, we know consumers are being harmed because they come to us and we have to tell them there is absolutely nothing we can do. The federal government prohibits or getting involved in this. And then they go to CMS and CMS is understaffed and they sit there. And these are people that may not have a lifetime of experience dealing with insurance. These are people that may be older, that may not be as tech savvy as some of us. I know I'm not as tech savvy as my daughter. My granddaughter's starting to get her tablet now, but that's separate. But one of the things that we said there to CMS, the federal government, we will take over. We're not going to impose our own rules. We'll use your rules, but let us help consumers. They have not yet said yes to that. Now, in terms of local information, anytime something happens, and actually on an ongoing basis, we're trying to get the information out, whether it's, there's a disaster, what do you do next? Or how do you prepare for that? The disaster is what's coming up. How do you interact with the insurance company? We do all that. We are trying, as I mentioned, we are about to resume full blast. What I personally like, the idea of going out to places where we will meet people that you don't necessarily meet online. And I've got a particular affinity for that. My 95-year-old mother won't go online. She gives me her insurance stuff. All right. But we need to reach people. We've got people who are older who don't have any other way of hearing. And that's what we need to do. And that's what our Consumer Affairs Division will be doing. In addition, of course, we also have what I would consider the more reactive part. If people have a question or a concern, and every time I speak, I say it's not just a concern. Don't just call us when something goes wrong. If you're looking at buying insurance, if you're wondering if you have the right insurance, if you're wondering what to do, reach out. We've got a Consumer Affairs Division that is devoted to helping people. And they would be much happier. I'm going to speak for them here. Much happier helping people up front than having to resolve issues on the back end. It makes it so much better for everybody. But that's part of the big, we are expanding our education process. I think if you look at us, compare us to pretty much any other state, we do a great job, but personally, I don't think we can ever be good enough. We're going to use every avenue we can to get to people, to get that usable, accurate information to people.
Yeah. And lastly, the price of insurance and how it's going up and up and up. What kind of influence do we have here in Connecticut in regards to changing that? Or is that something that we have to push with our federal delegation?
Or, whether it's life, health, and property casualty, we follow the actuarial standards where that's the definition of being a regulator. So it's not unfairly discriminatory. It is not excessive or inadequate. That's what we have to look at the rates. Because insurance is in many ways a risk signaling mechanism. And if you look at California, you see what happens when the market gets distorted too much. California had Prop 103. It worked for a while now. They're trying to recover from that and they have to make significant changes. What we are looking at here, we are encouraging, we want to make sure, that you have a viable competitive market, because that will help drive the cost down in and of itself. We want to make sure, and when we look at these rates, one of the things we're doing is we're making sure these are Connecticut rates. These apply to Connecticut, that it is not because there's a wildfire in California that your rate is going up, at least not directly. And the reality is that, the cost of lumber goes up. It's going to go up for everybody. But we want to make sure that what goes into those rates is proper. We want to make sure that, again, the consumer is getting whatever they're spending, it is as affordable as possible. There are limits below which we cannot go. We can't do something that we know is going to harm consumers in the long run. And that's what would happen if we ignored the solvency issue. Because the way we look on it, if you buy a policy today, then if that fortuitous event, whatever it may be, happens 50 years from now, you should know, you should be able, there shouldn't be a question as to whether or not you're going to be able to get paid for that. So, and that's why, so that's what drives the way we look at rates.
Thank you, sir.
Thank you.
Thank you, Madam Chair.
Representative Nuccio.
Thank you. Thank you, Commissioner. I could sit and talk with insurance about it. Like, unlike Kathy, I love it. But my question for you is in regard to the adjust funding for reflect current requirements. Do you happen to know what your current lapse is in PS?
Sure, I know I have that somewhere in here, and I will tell you while I search for it. Part of the issue, and it's in many ways a fortunate issue for us here. It's not fortunate in terms of the, did we just, yeah, it's not fortunate in terms of building up the kind of institutional knowledge that we've had as a department. But what tends to happen with insurance departments is that you get cohorts coming in. And certainly with the incentives that the labor agreement did, we had a significant turnover. We were looking at 47% possible turnover. Next year, we will probably have some more turnover that we have to deal with. We have been fortunate in that it's been a difficult market because everybody's going after these people. We've been able to fill almost all of the positions. But what happens, as you know, is that when we start, you're hired at a certain level, and then your salary goes up, fringe where that goes up. Replacing those people who've been with the state forever with younger workers actually lowers the cost, and that's what we've seen. Now, just to take a quick look here, and I want to thank my deputy for providing me with this. The lapsing accounts on June 30th, we had personal services, which was $340,000. Other expenses, $5,300. Equipment was $2,800. Fringe benefits were $410,961, so $411,000, and there was no lapse in indirect overhead. So 90% of the lapse balance was attributable to either personal services or fringe benefits.
Okay, because I noticed they're taking $750,000 out of your PS and then another $562,000 out of fringe benefits. I'm assuming there's no headcount reduction in that, and it's just a matter of opens and.
Absolutely. There is no headcount reduction. OPM has been transparent with us. They have worked with us. They showed us the calculations based on the workforce we have now, and we agree that we will be able to continue to do our duty and that there will not be a negative impact to the department.
Okay, so you're comfortable with that?
Yes, I
number
am.
then? Okay, and then I just had one question in regard to, I know how you guys are billed back through the assessment, the Department of Insurance Association of Appropriations Assessment. So when we see these savings, like for instance, the adjusting the fringe benefits to actual rates was 2.5 million, and then another 1.3 million here. In years that you have lapses, so in the June 30th lapse that you just spoke about, do you guys go back and credit the insurance companies, like the assessment for that, or do you just build it into the following year?
I'm going to turn this one over to my deputy commissioner, Jared Koski, who has spent way too much time on these, but he's the one I have people call whenever they call me, because CEO will call and I'll say, Jared's handling that, so let me turn it over to Jared.
Yes, Representative Nuccio, as part of the calculation that we do when we get the information from OPM and other entities as to what it's going to be to fund them, we get that total calculation, and then yes, we credit it based upon whatever lapses that we have in that calculation, which always makes things trickier when you're getting a number and then recredit it. You know the complications with regard
I
to the
do.
calculation.
Yes, I'm in charge of recovering them. So I just wanted to ask the question publicly because I think that's an important thing to note. So when you see these lapses like that, it's not that this money is getting swept into, any of the money of the general fund, that it does actually go back through the same process, and it is an adjustment line on your current year of assessment of appropriations. So just wanted to make sure. That's all that I have. Other than there was a comment made in the OFA briefing that you guys currently have 9 vacancies and that only 6 of them, though, are being approved to refill.
Let me just take a look at the number as of January 1st, 2024. Let me just take a look at
24 or
head count. Total
25?
head count that we have right now, we have open 10 people.
You have 10
uh,
vacancies.
10 vacancies. Some of them are in the works. You know, as I mentioned, filling these, you know, we've been, and God bless the people in HR for at DAS, they've been working hard and we've been pushing them really hard to try to fill the vacancies to get.
I think
people
at
in.
some point the public has to accept the fact that, you know, below Gen X, you know, there is no employee that's going to stay with you for 20
No,
years, right?
no,
You know,
there
there's it's like, if you're at a job for more than 2 to 5 years, people
Mhm.
question your sanity. So, you know.
So we have people come. Fortunately,
Exactly.
we've been able to get good people. You know, some of them are going to leave. So right now we're down, I think we're down, actually, is it 10 or 8? I've got, sorry, the net down right now is 8. And I think if I recall, we have about 3 in the pipeline, in the hiring pipeline.
Yeah. So right now, of that 10, 2, I think are identified as part-time. I think
Yeah,
that
8
has to do
full-time.
with TWR type things, retirees that we have, which have been a blessing to be able to keep that knowledgeable staff on for a period of time afterwards to train up the new folks as well. But yeah, I think it's around 6 or 8, for which I think, you know, within the month or so, 3 of them are going to be filled. The rest of them are in various stages of recruitment. So I think for an agency our size, roughly 150 people, you're always going to see that fluctuation of around 5 positions, give or take, as people come off and come on from the department.
Yeah, it's typically about a 5% vacancy turnover rate, right? Okay. But my question also, though, if you could just quickly answer, in the OFA meeting, they said of your opens, they said you had 9 at the time, right? But they said only 6 of those 9 have been approved to refill. So does that mean that you don't have approval to refill all of your opens, or?
So far as I'm aware, at this point, we had approval for all unless that has changed.
Yeah, I think all of them are approved. There's
Okay.
none that are being taken back this time. I think that's just an aspect of this UKG system that we've developed with centralized HR with regards to hiring, and I'm not familiar necessarily with that, but there are certain classifications within that system that may designate something as such, but we have not been told that there's any positions that are vacant that we cannot fill.
Perfect. Thank you so much for the information. I appreciate it.
Representative McCarthy Vahey.
Thank you very much, Madam Chair. Commissioner, it's nice to have the opportunity to see you all in person. And I'm going to return to the comments Senator Austin was making, which were extremely interesting to me and I think very relevant to the future of insurance for us in Connecticut and in the nation. And I know that in the governor's address, he talked about the updates to those flood maps and that there is, I believe there is some bond funding perhaps being made available to help to do that work. And I wanted to ask you, do you work in concert with the GIS office to do that work? And are you in communication with them about that, or is your work adjacent to that?
Our work is adjacent to that. This is separate. And I will tell you, and I'm going to hedge just a little bit here, because part of what we're doing is making sure that we have the best solution that's sustainable for Connecticut at the lowest possible cost. So we are looking, as I mentioned, and I mentioned First Street Foundation only because they're one of the leaders. It's a nonprofit organization. It's University of Texas. We just recently started working with Rhode Island, where they created their own system. So we are looking to see which one works best. We know that one of them has to work best for us, but we don't want to commit to something until we've decided, yes, this is sustainable, and this is not going to be an incredible drain on the budget.
Will you be in communication with the GIS office? Or I asked that in part because when I was planning and development chair, this was an initiative that I was very interested in Connecticut building upon and kind of leveraging the work that's done across different departments. When we think about, individual property and casualty, we also think about impact of storms on our roadways and our railways. And so I guess that is part of my question is, will there be a conversation there, and not just with the GIS office, but also with some of our planning and development folks, the Office of Responsible Growth, in part to Senator Austin's point and to your point about we'd prefer to prevent some of these things. So thinking about where and how we build, not just the building materials we use, but the places that we're developing, and certainly we've seen that impact. You referenced California, and I believe Phoenix, for example, is now requiring that there be a display that there's a certain amount of water before they're allowing zoning. So thank you for,
Yeah, and I just can't comment on GIS at this point in terms of whether or not we've actually met with them. I'm sure that will be part of the ongoing discussions that we have because we are casting a broad net and we need to reach as many people as possible. I also do agree with you that we need to reach out to the various municipalities that are affected one way or another, and that I'm blanking on the name of the organization, but it's the risk managers for the municipalities. And I was at their, not sure if I call it if it was a conference or just discussion. I spoke to them and I did tell them how committed we were. And one of my assistant deputy commissioners, George Bradner, is designated as a person who will be or who is in contact with them. And I think the point you make is important. This is a holistic, or this has to be addressed holistically. It can't work if we are going to do this part here and this part here, and there's no coordination. And that's what we want. And it may mean that we're losing a day because we're making sure that we're reaching out to everyone, getting as much input as possible. But again, I want to make sure we do it right.
thank you very much for that answer, and I appreciate that. I couldn't agree with you more. Thank you, Madam Chair.
Representative Delnicki.
Thank you, Madam Chair, and great to see you, Commissioner. I have to commend you on how you've taken the public hearings on health insurance increases. The first one I attended was in 2017, and to see the level where it's gone to and the details that are brought out, and in all honesty, the fact that you have the major players there and you're grilling them. My question is this: how much staff time does it take to actually come up with a final product, number one? And number two, are you using artificial intelligence at all to bolster the results that you come forward with?
Let me answer that with the first part of that question. Pretty much the entire division, the life and health division, as well as the actuaries, a part of the actuarial staff and the data scientists that's devoted to this, are doing this 24/7 between following. That's part of what they have to do. That's part of it's that crisis time. We need to be able to get it through. So, and they've done a great job of doing that year after year. These are experienced people. That's where I speak of the value of institutional knowledge, who know in many cases what to look for that may not be obvious at first glance. And they ask the questions. It's a back and forth process, because what you see even at the rate hearing isn't necessarily what a company started with, because we will say, why are you doing this? What's here? Can you explain this? And some company may be smart enough to realize that that shouldn't be in there. The use of AI is, we are waiting as we move forward. As you know, the state has certain requirements governing the use of AI, and we are waiting to see what we can do. We did start, and this was earlier on, with property casualty and with rate and form filing, because that was a pretty straightforward use case. I would love personally to be able to turn AI loose. But, is it OPM or DAS is working with that? And as soon as they give us a go ahead, whatever support they can offer, we would be willing to embrace it. This is an issue for insurance regulators in general. We know AI is being used on the company side, and we applaud that so long as it's within guardrails. And I believe in making sure there's innovation, but I also, you have to make sure consumers are protected. But I don't think we can fall behind. I think we need to use the same tools they do. And that certainly is our desire.
Yeah, it's interesting. And I appreciate the answer there. And I'm by no means saying that you should be replacing staff with AI, but it could afford a cross-check to see what the final end results are. And the discussion pertaining, of course, now to what used to be the FEMA maps pertaining to 100-year floods are now basically outdated. And now even in my case, I have a water course in my property, and I've seen flooding that's pretty dramatic compared to what I've seen over the course of the past 60+ years. At what point is that going to become a almost unmarketable product, or will you still make sure that that product is available?
Flood insurance?
Yep.
That is going to depend on the federal government, frankly. You know, what we have, what we look at, you know, FEMA, the NFIP program, which is what most people will have, is a federal program. And so long as FEMA continues to exist and the feds continue to fund it, we know it's a program that has lost a significant amount. It has not been sound financially. But in many ways, I think we would say that's a necessary program as we look at the market right now. So we would hope they would continue. Every time I go talk to our DC friends, I say, can we please get a long-term authorization of the NFIP so that people can plan properly? You can't. Uncertainty for me is not a good thing when you look at when you're buying a house. You don't know if you're going to have flood insurance 3 months from now. So that's one of those things. So in terms of, for most people, it will be the NFIP, which is run by FEMA. And I would hope that will continue. We are trying our best to create, and essentially it's creating a private flood market. The problem with that is that that tends to be expensive, and it tends to be focused more on the higher end properties. Now, actually, I think it might have been just yesterday or two days ago, I was talking to I was being told, talking to somebody at a company who was telling us about a reinsurer that's offering us what is essentially a low-cost product. It's not going to be huge dollars, but it can help fill the gap for the minor damage, for instance, 10, 20,000, whatever that is. And Deputy Koski can tell you that I said, let's get him in here. I know, I want to know if we can get this in Connecticut so that we can fill the gap. Flood is going to be expensive, one way or the other. We got to make sure that FEMA is there, and we have to do everything we can to let industry know that, especially, where they can, they're going to only do it if they can make money, which we all know, but that we will support them as they move forward to create a private flood insurance program. Part of that also is trying to act as a go-between. One of the downsides of the NFIP, and I will tell you, I have an NFIP, the National Flood Insurance Policy. One of the downsides of that was that there were certain discounts that were grandfathered in when they changed the rates the last time. You go to a private carrier, you lose those. We've said that's not real. If you want competition in the market, you have to let there be competition in the market. But again, it's part a significant number, or significant percentage, if not all of that, is at the federal government level, and we can only keep pushing.
And just for a moment to revisit the vacancies that you currently have, how is that hamstringing you?
Not sure I would say it as hamstring us. There are, just with everything else, if you've got a vacancy, you've got to find somebody, and it may mean in most cases that the people around them have to start to fill in the gap. They've got to work through the night.
And the difficulty level?
We are a very lean agency, let me put it that way. We have always been very lean. I mean, if you compare us to the workload that we have with some of our fellow regulators, this is not an agency that's overstaffed. And the complexity, as well as the quantity of the work, is increasing. So that's why we need to fill in the gaps that we have. But we're also working at seeing what we can do in terms of using technology. Because technology is not just, I don't see it, and I will say this as my personal opinion. I don't think we're going to be anywhere near the point of reducing staff. That's the idea. If anything, it would be the flip side. But if we can get technology to make people more effective so that they're not spending their time going through, with AI, for instance, going through a 200-page document, trying to find how it reads against the law, when AI program can go through that and get you an answer in 2 minutes. Frees up your time to do the higher level tasks. And I still remember earlier on when I was talking to the department and saying part of what I believe in. I know we have so much to focus on day to day. What I would like is that you have enough time to also look to tomorrow, because we can't just focusing on today is not enough. We know there are emerging risks that we will need to address. Let's look at those. Let's make sure people have time to think strategically. So again, it goes back, my love for AI, because I think it will make us a better organization.
Well, thank you for your answers there, and
Thank you.
thank you, Madam Chair.
Thank you. Are there any other comments or questions? Seeing none. Thank you, sir. Have a nice afternoon. Appreciate appreciate you and your whole department. Thank you.
Thank you so much. Have a great holiday weekend, and remember my offer to have people, because that's one of those things that we really like doing. If you've got a town hall, if you've got a meeting.
I'm going to
just
talk
reach
to a
out.
couple of our outreach staff to talk about this. So I
Okay.
think it's important for us to start getting it out there.
Absolutely.
Thank you.
Happy to help. Thank you.
So we're going to recess this meeting, and we will be back at 1 p.m. And we will start with the Workers' Compensation Commission. Huh?
So I have a lot out of the way that I have to go to, so, I'm back. For. Tony will probably. Yeah. But I don't know, I was asking both. That's why you never. Yeah. Well, because they end up big photo sound effect. So like, we're not gonna listen to what you guys do.
Right.
So. All right. All right.
fix those lights, maybe, I don't know. Everybody who's on the list is there.
All right.
Oh, so everybody is on Zoom? Oh, no, just the workman's comp.
We got 2 minutes. 2 minutes.
2 minutes. Taylor ordered me some lunch and
It didn't come in?
hasn't yet, and hasn't gotten here.
Really? Really? That's not good.
No, it's not.
Good afternoon, everybody. Are you all set, you two over there?
I'm so,
Not you two.
I'm set.
You two are always all set. Don't worry about that. So we're gonna reconvene our meeting and starting with the Workers' Compensation Commission. The Workers' Compensation Commission is here on Zoom, and the chairperson, Stephen Morelli, is online. Sir, do you want to start off with any opening comments?
Sure. Thank you very much. Good afternoon, chairs, Senator Austin, Representative Walker, ranking members, Senator Summers, Representative Nuccio, and members of the Appropriations Committee. As Senator Austin just mentioned, my name is Steve Morelli. I'm the chairperson of the Workers' Compensation Commission. As you all know, we are a special fund agency, and we are funded by an assessment upon Connecticut employers, which is administered by the Treasurer's Office. Our requested budget mirrors the governor's budget, so wholeheartedly support the governor's budget as presented. Joining me today are our agency's legislative and administrative advisor and legal director, Marie Gallo Hall, our business office manager, Frank Calvi, and our manager of research and planning, Rich Hamby. We're happy to answer any questions you may have. Thank you very much for your time.
And did you, thank you very much. And did you say that, who does your administrative work? Is that done, by the treasurer's office, or do you work under the confines of the comptroller's office? Or are you a separate workers' compensation commission with the respective human resources people within your agency?
So we do not have our own human resources here at the Workers' Compensation Commission. We are under the umbrella of DAS. We do have our own fiscal department, and Mr. Calvi can probably elaborate if I'm getting any of this wrong, but we are overseen by OPM. The fund, the Workers' Compensation Commission fund, is administered by the Treasurer's Office.
Do you make recommendations on workers' compensation for individual cases?
When you say individual cases, I'm not sure what you mean.
So someone applies for workers' compensation within a state agency. Do you weigh in on that at all?
So we're an adjudicatory body. If someone, you're talking about state employees, Senator Austin?
Yes, talk about state employees first.
All right, so if a state employee brings a workers' compensation claim and it's paid by the state, we don't see it. If it's contested and they request a hearing, then it goes to one of our 8 district offices, depending on where the employment is, and hearings are conducted. If the issues are resolved, fine. And if they're not resolved, eventually it'll go to a formal hearing, which is a trial. And the entitlement to workers' comp benefits for that individual employee is determined that way. Does that make sense?
Yes.
Okay.
And do you handle workers' compensation for private employers too, or just contested cases for private employers too, or do you just hear for
any worker in Connecticut that brings a workers' compensation claim that is contested, or there's confusion, say, for an unrepresented party as to whether they're getting what they're entitled to or they're getting the full amount they're entitled to, can bring their case to one of our 8 district offices, and it's handled the same for private employers as it is for the state employees.
And the 111 people that you have working for you, what job classes are they?
We have actually 96, I believe, positions at the moment with 10 vacancies.
Okay. And what job classes are they?
I'm going to have Mr. Calvi respond to that in a moment. I will tell you that 3 of them we're down 3. We have 16 administrative law judges by statute, and we currently have 13. 3 administrative law judges have been nominated by the governor. I believe their hearing is scheduled for February 24th with judiciary, and sometime after that, they'll go before House and Senate, and then we'd be at our full complement of 16 administrative law judges. I don't know what class the judges.
That's a job class, administrative judge would be a job class, or you would have a clerk or a judicial marshal, or in some cases, not with your agency, but they would have nurses or some other people. So I was just trying to figure out how many supportive staff do you have, how many top level judges do you have, et cetera?
Yeah, well, like I said, we have there's 15 judges that are spread amongst the 8 districts. I'm the chairperson. I'm at Oak Street in Hartford. Those 8 districts have between 6 and 8 typically employees in each district, various gradations of levels from the district administrator down through office assistants, who all have, typical office functions, mainly there to support the judges and schedule hearings, get documents prepared for hearings. The focal point of the district offices is to support the judges in their conduct of hearings that they have each and every day.
of Thank-
the week.
Thank you.
Yeah.
Representative Walker, do you have any questions?
No, I'm good. Thank you.
Representative Nolan, questions?
Good afternoon, sir. I would just
Good afternoon.
want to revisit the 111 people, but only 96 listed. Could you send us our administrator the jobs that are vacant, just so we know, have a record of what they are?
Yes, absolutely. And I'll defer to either Rich Amy or Frank Calvi. Have we already done that?
We haven't sent it over, but I do have a list of all the vacant positions. I'll be more than happy to send it to you, sir.
Okay, thank you, Frank.
Thank you. And you said that you're basically gonna be using the same numbers as last year, or you're gonna be following the governor's budget. Does that mean that there's no, I just lost my train of thought.
Nothing additional?
Yes, nothing additional that is needed to come outside of that?
Not at this time. No, we don't anticipate the need for any additional funding other than what we've budgeted for. And as I said, which has been mirrored by the governor's proposed budget.
Okay, and if you can just share with us what steps are being taken to streamline the claims process system to reduce delays for injured workers?
I can tell you that we generally use a barometer, for want of a better word, of initial dates to your first hearing when you request a hearing of 28 days or less. And we've been consistently well under that for all 8 district offices. So if there are delays in, there's 2 different concepts. There's delays in getting a hearing, which I don't believe there's a problem with that because we're where we're supposed to be or better. And there's delays in the perception of injured workers in terms of when they're being paid.
Right.
So for someone who has a denied claim and they're not getting paid and it has to follow the whole adjudicatory process to a trial, they're going to feel like, well, this is taking forever for me to get my benefits. But I think it's also extremely important to know that the vast majority of workers' comp claims never hit our system. And that's because, you're at work, you fall, you break your arm, it's witnessed, they send you to the doctor, you get a cast, you're back at work, they pay for it, no issues, it's not contested. That's the vast majority of workers' comp cases. What we have are the contested claims, or in some instances, initially claims that aren't necessarily contested, but because they've gotten an unrepresented party gets something from the employer that confuses them or makes them think it's contested, they request a hearing. A lot of those cases, the hearings are one and done. They come to the hearing, judge brings them into the hearing room with a representative from the employer. It's explained to them that, this is what you're entitled to, this is what you're getting. And unless there's a problem down the road, we never see them again. Does that make sense?
Yeah.
Okay.
All right, thank you, sir. Have a good day.
Thank you.
Thank you.
Yep.
Representative Nuccio.
Thank you, Madam Chair. Quick question for you. In your reflecting your current requirements, you have a $700,000 reduction in personnel services. Are these lapse dollars? And if so, what are the lapse dollars currently projected to be for this year?
All right, I'm going to defer that one to Frank Calvi, our business office manager.
Okay, the lapse in amounts was for personal for with $20,419.66.
I'm sorry, when was that for? Can you say that again, please?
It's $20,419.66.
And that was for this last year?
Yes.
But they're taking 700,000. So is that like a holdback, or is there a headcount associated with that? Are you guys comfortable with this amount?
Yes, we are comfortable with this amount.
Okay. And you think you have enough vacancies to be able to handle this without an issue?
That is correct.
Okay, that's the only question that I have. Thank you.
Are there any other comments or questions? Representative DiCaprio.
Thank you, Madam Chair. I was just going to ask about the vacancies. I think 3 of those, if I heard right, were for the judges. the
That's
district
correct.
law judges? And
Right.
are there any recruitment efforts on any of the other open positions or?
We have 2 office assistants that we anticipate will come on board shortly, like within a month. And then the balance of the positions will be staggered throughout the year. But we haven't really had difficulty filling positions, to be honest with you. So we don't anticipate we're going to have any problem.
All right, very good. Thank you now. Thank you, Madam Chair.
Excuse me, any other comments or questions? Representative Baker.
Thank you, Madam Chair. I apologize if I might have missed that on. The funding for indirect overhead costs, what is that related to? What is the breakdown on that? To the
All right, well,
control?
that's set by the comptroller's office.
Mm-hmm.
And that, indirect costs is just like, it covers like a, variety of things, like, the, electricity, all kinds of,
Can you speak up? I'm having a little trouble hearing you.
you cannot hear me?
They're going as loud as they can, Andre. That's as loud as they can online.
Oh, okay.
You're not going to get them any louder than
Okay.
that. That's the online problem.
Oh, okay. All right. Well, you can continue. I hope I can get it.
Yeah.
Frank, articulate some of the specific indirect overhead items that we pay for. I understand, like utilities, et cetera, but we have the district offices that all have bills associated with them. But go ahead, Frank.
Yeah, it's pretty much it. It's just, I was just to reiterate earlier, just that this is like, it's the comptroller's projected amount, and it's just a variety of things, like just pretty much your everyday operating costs, like of an office, like, it could be, utilities, rent, it could be security costs, it could be, a number of items, just, like your everyday operating costs to operate an office.
Okay. All right. Thank you. Oh, thank you, Madam Chair.
Are there any other comments or questions? I think you're all set, sir.
All righty. Thank you all. I appreciate the
Thanks.
opportunity to be here. Have a good day. Have a great weekend.
You too.
Thank you,
everyone. Bye.
Bye-bye.
Thank you.
Up next, we have the Department of Banking. Are they here?
Yes.
Online?
Yes.
Okay. Who is Jacqueline, Fiscal Manager, and Matt Smith? The two of
Yes.
you are on, right?
Yes.
Okay. Do
Good
you have any?
afternoon, Chair Alston, Representative Walker, Representative Nuccio, honorable members of the Appropriations Committee. My name is Matt Smith. I'm the Director of Government Relations and Consumer Affairs here at the Department of Banking. Joining me today is Jacqueline Shirley, our business office manager, and we are happy to answer any questions the committee might have concerning Governor Lamont's proposed biennium 26-27 budget.
All right. So we see that you were asking for 128 positions and the governor recommended 127. How many positions are filled?
Currently in the agency, we have 121 positions filled. We have 7 vacancies, which we hope to have filled by the time the spring, summer time comes around. We're in the process of filling those now.
Looks like the governor cut down on one, so I strongly suggest you talk to them about that and let us know if that's something that you can live within the confines of.
Okay.
All right. Does anybody have any questions for the Department of Banking? They don't really have a lot going on in this budget. Good, guys. Representative Baker, are you all set? Okay. I think you came on just to say hi.
Hi, it's always great to see all of you.
Nice to see you too. I think we're all set.
Great. Thank you so much.
Thank
all
you.
right.
Have a
great day, guys. Thank you.
Bye.
I saw Stephanie Thomas downstairs.
So I would assume so. That's 3 o'clock. And then, Department of Emergency Services.
Commissioner, if all of your people are here, you can actually start early.
It just means we're gonna have more questions for you.
Good afternoon, sir.
Good afternoon, Senator. How are you?
Good. I'm good. Do you want to say a couple of opening comments?
Absolutely.
So let's give yourself time to get
Sure.
situated with everybody.
So my name is Ronell Higgins. I am the Commissioner of the Department of Emergency Services and Public Protection. It is good to see you all again. I am joined by several members of my team here who I've asked to come to, not just to see, but to be a part of this process. I'll hold on my opening remarks. We did in fact provide some testimony, and Senator Austin, if I can recall from last year, you like to get right into it, so
That's me.
we are here for you.
I'm sorry. I'm
She's
a
not
little
sorry.
pushy.
She's not sorry.
I'm not sorry.
She's not sorry.
Not at all. Thank you. So, Commissioner, first, we have a caucus that's called the Sportsman's Caucus. And one of the things that we go over every couple of years is kind of like what is related to sportsmen's, and Deep usually comes and gives us an update, but there's one section that you may have some interest in having one of your staff members participate in. It's usually just to talk about different things related to activities that people who do camping or hiking but another part is target shooting. We still have, the fact is that we still have some high school rifle teams and other things. And I didn't know if that would fall under your purview or other purviews, and I didn't know, if you were interested in participating in letting our Sportsman's Caucus members know of any updates on rules or regulations revolving around this issue. It's a really kind of an informal back and forth to get information for members of the General Assembly. We're still, they consider this one of, uh, there are still national and international teams that participate in things like this. I didn't know if that was something you were interested in participating in.
Absolutely, Senator. I believe there is a lot of overlap in what you just described and some of the expertise and experience members of DES, specifically CSP, can provide. So yes, we would like to be a part of that.
So my staff sent over an email a little bit ago on a meeting that we were going to have, and if I could have your legislative person contact him so that we can set that up. And feel free to join us. Commissioner Dykes is going to come, but if you're interested, come. I know you're super busy, so don't feel any obligation to come. We think that it's an important area, and in particular in the rural part of the state, we have a number of people that still participate in activities related to this. So
appreciate that opportunity.
thank you. So there's a couple of things that do you know where you stand relative to pistol permits, and have we been able to resolve any backlog relative to that?
Yes, Senator, we have been able to resolve some of the backlog. I will ask Colonel Lockman, who is here with me today, if you want any specifics to
Sure.
to join the conversation about that.
Sure.
Good afternoon, Colonel Daniel Lockman. I'm the commanding officer of the Division of State Police, and I'm also a deputy commissioner of the Department of Emergency Services Public Protection.
So do you have any idea where you stand relative to pistol permits backlog? Are we 2 weeks out? Are we 2 months out or longer? Do you know?
time frame, I'd have to, I could get that information for you. We have made significant progress in
Right.
reducing the backlogs. We've been working diligently to do that. As far as time frame, I'd have to get you a exact number, but we've reduced that significantly.
I appreciate that because I'm not hearing from as many people as I was hearing from, so I do believe that's accurate. I just want to make sure that we've given you the resources to decrease that backlog, and not put additional pressure on either you or the residents.
We've filled some vacancies that were within the unit. We've also improved the efficiencies within the office as well. Yes, we are supported.
And relative to the issues for volunteer fire companies, I do see one thing that was eliminated from your budget for the limited highways program. And actually, I think your agency does a lot of things people don't even realize that you have responsibilities
Yeah.
of. And apparently you're the full purveyor of firefighter services, both volunteer and not. And so did this dollar amount not get used, or was it well used? Do you know?
It was fully used. They used all of the funding that was provided, Senator.
So it's not a program that there wasn't a need for.
There was absolutely a need for it. The funding was used. I understand the reason why
Yep.
the decision was made to go in the direction that it's going.
And I understand, I don't know necessarily that that I always agree with that kind of decision, in particular, since many of our rural communities count on volunteer fire companies. I have 10 towns and 15 volunteer fire companies. I know what it's like to go to a chicken dinner or a pancake breakfast because they have one or the other all the time. Then I also noticed that you had a $3 million decrease in year one and 6 million in year two on a staffing and duties assignment assessment decrease. Do you know what that's relative to?
Oh, yeah, that is the staffing reduction for sworn staff.
In what job classes, sir?
Oh yeah. So that is the duties assessment. We are going to undergo an analysis, a very intentional analysis, so that we can identify the best ways in which we can use non-sworn people for positions that are currently being occupied by our sworn members. We want to put our sworn troopers in the highest best use possible. So we're going to do an analysis to try to see how we can get our troopers back on the road and get some highly skilled professionals that are not sworn into some of these positions.
But would it be fair to say that some of those, would that still leave you with some positions for those that are on limited duties?
Yeah, it would, but it would also help us in reducing overtime. Again, highly skilled, highly capable, but they do work with a contract. So we believe that if we can identify some highly skilled civilian members to put into place, we can reduce the need for overtime. What's happening is we have additional overtime needs in the field, on the road. And those positions, those patrols have to be filled. And those come at a cost, and it's an overtime cost.
And relative to state police and your sworn officers, what is your fill rate and where are you on vacancies for
We
them?
have 928 troopers today.
So there used to be a state statute, which we eliminated a number of years ago, that was over, I think it was 1,128, 1,200?
1,240.
So,
Mhm.
but this is still well below that number. And if we, what are the position vacancies for state police?
We would estimate about 200 right now.
And that's 2 classes, maybe?
No, it's more than that. Senator, we're struggling like many other law enforcement agencies nationally with recruiting, although they're doing some really good work. Two classes would not do it. The number of people that are applying, up to 1,300 applying for a test, we're fielding a class of between 25 and 30 members out of those applicants. So 2 classes will not do it. We're not going to be able to recruit and hire our way out of this, which is why I think it's important that we undergo an analysis to determine how we can get troopers that are currently occupying administrative roles that don't necessarily require a sworn member to do back into positions in the field and identify civilians that can do that work. We have to continue to recruit and hire, but we also have to identify ways in which we can reposition these other existing troopers.
And lastly, you and I actually had a small conversation on a policy that was in another committee, not having to do with DESP. It has to do with DOT, and it says roadside phlebotomy. And so clearly I'm opposed to the process of doing that. I think you have a lot to do already. Have you made, has the department looked at it and seen if they are interested in making a policy statement? Is this something that you want to see your troopers do? My understanding is it would not happen on the roadsides, even though that's what the title says. It would happen in the barracks. I am so opposed to this. I want to make sure I'm not coloring my question with my opposition. But do you think that troopers have time on the roads to be pulled off to do phlebotomy and other such activities?
Senator, for me, it's not even a matter of time. It's are they the best equipped? Are they the best resource to do that work? Right now, so first and foremost, the Vision Zero program that is out of the Department of Transportation has some really good recommendations. They have done some amazing work. It's a federally funded program, and they have put forth some really good recommendations. One of the recommendations was a law enforcement phlebotomy program. Vision Zero has done some amazing work to help reduce fatalities in the state of Connecticut, and so I support the program. However, I don't believe that police officers are the best, or troopers are the best suited to draw blood, And so we are thinking creatively within the state police about how we can partner with other public safety resources that may be better suited to do that work. Fire, paramedics,
right?
Other, contract with phlebotomists,
right?
Sponsor hospital in New Haven. We don't know, so we're exploring that right now. We do believe it's important that we have that skill set available to us to draw blood, but I just don't believe along with everything else, our police and our troopers have to do that. They're the best suited. Not everyone will agree with me, but as someone who supports the work but just doesn't believe that police should be doing this, that is my position.
Thank you. I think that's part of my concern. I just imagine that there's already conflict in a stop. That do we want that intimate action to happen between someone who is stopping somebody for a possible action that people are going to have long-term consequences? Do we need to add one more conflict in that is my concern. So that's just me, you know, I understand having the tools, but I also think that when people talk about doing phlebotomy because they want to test for drugs,
Mhm.
but every drug has a different lifetime in your body. Marijuana lasts a long time. You're never going to know by taking a blood test if they've had just smoked a joint or that's leading to that accident that happens. There are other things that have to be allowed in that testing process. And there are other drugs that have different interaction timeframes. So I think that to use that as a tool may be a piece of the puzzle, but not the whole puzzle. So, questions? Representative Nuccio, followed by Representative Walker. I'm trying to figure how long you're going to be here for.
Hi, Commissioner, how are you?
Good, Representative.
Good.
Thank you.
I have a follow-up on the duties assessment that you're doing. Looking at this number here, when we were in our OFA briefing, they said that they were looking at multiple different things, one of which was putting troopers back, taking them off of clerical roles and putting them back onto the streets, right, on the patrols,
Mhm.
which I think is great. But my question is, if you're going to backfill that with civilians, is this price offsetting the cost that you're going to have to pay civilians to do those clerical roles?
So we believe that the amount of overtime that it costs to have troopers in these roles would absolutely cover that.
It would. So
Absolutely.
the 3 million and the $6 million reduction would be inclusive of also paying civilians to do the roles.
Yes.
Okay. One of the other things that they said that were being looked at, and I definitely want to understand this here, is that the possible reduction of FTO hours. Is that something that's being considered?
Field training
Yeah,
hours?
yeah.
I'm aware of that. No.
I'm very happy to hear that. And they were, okay, so that part I think I'm okay with. My problem comes into right now, if I'm correct, please correct me if I'm wrong, you guys are looking at a 4.5 to $5 million deficiency in PS this year, correct? So with that deficiency of 4.5 to 5 million, you add on a $3 million cut next year, or that starts in July, for a duties assessment that I don't think is done yet, you're looking at an $8 million cut in PS in year one. Is that, I have a hard time believing that that is going to be possible with what I know about just the state police part of it.
So Representative Nuccio, just within the last 3 months, I have asked that I have directed that we undergo an examination of our practices, our policies and controls. And within a 3-month period, we have reduced our overtime by 7.5%, just in a 3-month period. And we are also adhering to three brand new strategic pillars that cut across all 6 verticals within the agency that unify us around a strategy. The first is operational efficiency, excellence, and efficacy. The second, which is very relevant, is a shared sense of fiscal responsibility. Every family has a budget, and I want us to remain within our budget and to reduce unnecessary costs when possible, without reducing services. And lastly, accountability and ethics. We are the Department of Public Safety. We should be beyond reproach as we serve the citizens of the state of Connecticut.
So you're comfortable with an $8 million reduction from where you are right now, starting in July, which is 4 months from now?
It's going to be tough.
Yeah, I'm concerned just because, as you mentioned, every shift has to be filled,
Yeah.
right? And you can't not have a shift covered. So I think there's definitely possible reductions in overtime. I'm just at $8 million in year one and $11 million in year two is, I think, that's a stiff mountain to climb there. Also, one of the things that the Creates report mentioned, which I was very intrigued by, outsourcing fingerprinting. I know that takes up time. At the beginning of every shift, there's always, people getting fingerprinted. So is that something that we're looking at, outsourcing to a civilian operation, taking that out of the hands of the troopers?
Rep Nuccio, I haven't looked at that specifically, But I would say that that is something, that is a good example of something that could be on the table. Again, without having examined that, you know, in depth in preparation for this, I can't speak to it specifically, but that is an example of some of the things that I'm looking at.
I would think that would definitely be a good one. Another question that I had in regard to the there's a couple of items in these sheets here that say adjust reflect current requirements. We're taking $500,000 out of fleet purchases, but then 2 lines down, you know, we're looking at adding, you know, $500,000 in year 2 back for fleet lease obligations. I know at one point you guys were looking at a pretty strong conversion from the gas powered to the hybrids. And I know the fleet turnover. When I look at my daughter's cruiser, she's at about 200,000 miles. You know, I know you guys get your miles out of your vehicles here, but this part of this increase, are we still converting to hybrids or are we not? And kind of just seems like we're taking $500,000 out and then we're putting $500,000 back in. So I'm trying to understand what's happening with the fleet purchases for 26 and 27.
Yeah, we have recently, I have recently reorganized the agency, and our fleet is now under the direction of our CFO, who's with me today, Melanie Sparks. I'm going to ask Melanie to speak to that.
Thank you.
Good afternoon, Rep. Melanie Sparks, desk CFO. So as the commissioner said, fleet has recently come under my vertical, and I know that we have a lot of challenges with that. Specific to your question, we are seeing a reduction and then an add. The add of about $200,000 is really related to the increased leasing costs of our vehicles. It's not related to much else. Just like in normal purchasing, when you buy a car, costs are going up. So that $212,000 is really related to the increased lease costs when we lease our vehicles back to DAS.
And what's the $500,000 reduction?
That is reflective of a few years of ongoing lapses.
Okay. All right. So we're just not, well, you know, there's been a car shortage for a while, so we're just not getting them in as quickly as we'd like.
That's correct.
Okay, that's helpful. And then I really have only 2 other things. One is, can you tell me where crisis is in this budget? Is it in other? Is it in OE? No.
Yeah. So you're referring to the crisis program?
Right. So it's
Yeah.
in E, D, and C now. And I know recently, I think I mentioned to you when Senator Austin and I were at United Services, they had mentioned that they were told there were no crisis dollars for D, which we don't believe is accurate, that it's baked somewhere into your actuals, but there is no line item for crisis. So I'm wondering where it's falling in the budget and that we're still doing D, E, and C with that.
Yeah. Rep. Nuccio, one of the things that I examined when I arrived here was exactly that, where our crisis is, because you'll recall that the police accountability bill required police departments to examine the efficacy of a co-responder model, which I am a fan of.
Yep.
Our existing co-responder model with the state police is federally funded, and it is currently operating within 4 troops. It is not robust. It is not across all 11 troops. I would like to see that. Many other police departments in the state of Connecticut have adopted a co-responder model wherein when the police or a Connecticut state trooper has or encounters a mental health crisis, person in mental health crisis, that they are not responding alone. They are with someone who is professionally trained to help manage that sort of situation. So I think that is a best practice that was codified in the police accountability bill that it was good for Connecticut.
We're just not funding it, right? So you said 4 troops. I know DC, C, D, and E. What's the 4th troop?
F.
F has it also?
It was a federal grant.
That's the federal grant. So F is under the federal grant.
No. All 4 are under a federal grant.
No, we specifically put $200,000 a year in for D and for E, I mean, in C,
Okay.
in the budgets. So that's where I'm saying, is that in your OE and not PS?
Being supplemented by federal grant.
It's being supplemented. Okay, so I would really like to understand, as the conversation that you and I had, the full cost of rolling crisis out to all of the troops with the exception of the highway troops. Any place where we're going out to houses and stuff like that. So of the 11 troops, take away those 2, what we're at 6. So I think we would need to roll it out to about 5 more troops. And I'd like to understand as quickly as we can what the dollar impact is on that, because as you said, not only the police accountability bill, the crisis program is very helpful to troopers who are out there, who are not trained to deal with this. And having, after they make safe, having somebody that can come in and help, you see a reduction in calls, you're seeing a reduction in repeat calls. So in getting people the help that they need, crisis is imperative as far as I'm concerned. And I'd like to really understand the number so we can find a way to build that in. I'm willing to take other stuff out to put that in. So if we can get that number, I'd appreciate it. And the last question that I have is around DRE training. I'd like to understand how many troopers we have that have been trained through DRE, what the cost is and what we would need to do to expand that. Because as Senator Austin said, I'm not a fan. Trust me, my daughter who's a trooper, I would not let her draw my blood if you paid me. My daughter who's a nurse, I have a hard time letting her drive my blood if I had to. But there has to be, we have to have training. So I'd like to understand what the DRE training program looks like for the rest of the troopers, where we're at, where we need to be, and the cost for that.
That's a great question, Rep. I don't have the actual number. Colonel, do you have the actual number? We have 14 Connecticut State Troopers that are trained as DREs.
How many?
14.
14.
Out of 927.
Correct.
Yeah.
Yeah. One of the things that we have discussed here in within the commissioner's office is the idea of setting up that training here in the state of Connecticut to serve not just our agency, but other law enforcement agencies in the state of Connecticut. We understand that it is a partnership with the Department of Transportation, but we believe that this is going to be an ongoing endeavor, and we can reduce costs in sending officers out of state for the longer term training if we can set that training up here within the state of Connecticut. So that is something that we are exploring, because we, again, the difficulty in determining whether someone is under the influence of alcohol and drugs has become even more and more complex. So to the extent that we're going to be serious, and we are serious about our fatality reduction in the state of Connecticut, we need to train additional police and troopers in drug recognition as drug recognition experts.
So are we still only doing it in Arizona and Florida right now?
Arizona and North Carolina.
In North Carolina, that's
North
what it's
Carolina.
Arizona and North Carolina, right? So do you guys have any estimates of what it would cost to create a program like that? Is that something we could look at through bonding with the governor?
We can bring that to the working group if that's
I would
okay,
appreciate
because we literally just began examining that. So we would like to.
Because you could also then, like you said, you could offer it to local PDs also. So it would be, you could get cost recovery from that. I think this is definitely something that we need to explore with having marijuana legalized and alcohol. As you said, there's no way to test that. And I don't want anybody drawing blood on the side of the road. So DRE training is, I think, the next best thing we can do.
Agreed.
That's all that I have. Thank you so much.
Thank you.
Representative Walker.
First of all, good afternoon.
Good afternoon. How are you?
Happy Valentine's Day.
Same to you.
She's
DRE?
really hung up on Valentine's Day. I don't get it.
What is DRE?
Drug recognition experts.
Okay, so we are pursuing this method of evaluating people on stops. We are doing that now. Is that what I'm hearing?
No, drug recognition experts have been around for years. We were not training anybody, because I had bills in for the last 10 years on drug recognition experts to put the funding in. And they test through looking at your eyes and a number of, they do not draw blood.
Oh, okay.
The roadside phlebotomy that we were talking about, it's being conflated with each other, but roadside phlebotomy is new this year, or new being talked about with all of us. It's not new this year. It was a DOT grant.
Right.
And he said that he is not interested in this, although he says the tool of drawing blood is something that he's interested in.
That is correct.
Thank
Senator.
you.
Rep Walker, the foundation is standardized field sobriety tests. So police officers can go through standardized field sobriety testing through a class that is offered here in the state of Connecticut and in many states, and that's to detect drunk driving.
Okay.
Okay. And we do that in the academy as well. Okay. But as they go on in their career, they layer on top of that the drug recognition training. But then there's another level of training, the observational portion that is much longer, that we don't offer here in the state of Connecticut. And what we're saying is that we need to bring that training here to the state of Connecticut as a part of our efforts.
Okay. All right. Because I just want to, I'd had these conversations and I thought that's what I'd heard before. And I heard, never mind. Moving right along. So Post, you do, Post is supposed to provide training for the police in a variety of avenues. When do we train them on new laws that come to effect, and how do you do it? And how do you send it out to the other police departments, and do you follow up on that?
That's a great question, Rep. Walker. So the Post and the we regularly provide a legal update training, especially on new laws. I think we can do more. I think we could do more in terms of follow up. I'll have to follow up with you on that. It's police departments in the state of Connecticut do a pretty good job through the Chiefs Association and through the council of keeping their teams updated on new laws. But I would like to see Post, the academy, training academy, take more of a role in doing so. We have in the last year developed an even stronger relationship with our chief state's attorney's office under Mr. Pat Griffiths. And what we've done is we've identified areas in the initial training where we can bring our state prosecutors in to train. And during that initial training, they're hearing from prosecutors on new laws. But we also want to start to think about how we can bring them back in training as well.
Fran Carino used to do it back in the day. I don't know how far back in the day, but I know, yeah. But I'm not. But the reason why I know that is because he did the training for the juvenile justice bills, and he was always doing that, and it was fine. Then it stopped, and now we've had a variety of interpretations of the bills that have been out, which has caused a lot of problems out in the streets, which makes me very concerned. So it's not just that, it's not just JJ bills, but it's all bills about, sobrieties, about all these things that we're going through. And I think that we owe it to our officers, our local officers, to make sure that they've got the accurate information and they know exactly what their limitations and what they can do. So I guess if you have an idea of what you want to do in that area, I think it would be nice to hear about that in our follow-up, our work group, because I think for our purposes in Connecticut, it's important that the gentlemen and ladies that are responsible for our public safety actually know what's in that and what their responsibilities are. And I think that we have not done that for a while. So I would like to see something like that. You also had a group of teams from the state police that would go out and help different local communities in addressing some of their crime issues, like stolen cars and I forgot, drug raids, things like that. Do you still have those?
Absolutely, Representative Walker, and I'm gonna ask Colonel Lockman to speak to our ongoing efforts statewide.
Yes.
With stolen vehicles and other violent crimes.
Yes.
Thank you for the question, Rep. Walker. Yes, the
Wait,
Connecticut.
you got to tell us who you are.
Oh, I'm sorry.
He did before.
Oh, he did? Oh,
Yeah. This
okay,
is
my
just-
bad. I'm late.
I can do it again. I'm Dan Lockman. I'm the Colonel of Connecticut State Police. I also serve as a Deputy Commissioner to the Department of Emergency Services Public Protection.
Okay, I get yelled at by CTM because I never ask, and then they don't have the name underneath, so.
Understood. So the Connecticut State Police, we do work with the cities throughout the state, the big cities, New Haven, Bridgeport, Hartford, and Waterbury. We also have a contingent out east where we are working to curb and detect violent crime, the stolen vehicles, and drug offenses. We recently have engaged in some initiatives, particularly in Waterbury and New Haven, that have seen some pretty good successes, and we're looking to continue to build that out and to expand upon that. We've recently been engaging with our partners, our local partners throughout the state, to recruit some additional task force officers to the state police to assist us to do this, and we've been seeing some good results.
So when you say recruit, do you mean local police that are in different cities? you recruited them to be part of your team as you go out and do these visits, I guess.
That's correct. We bring them in under a task force, and that we work collaboratively to stem and mitigate some of the problems that are occurring within the cities and the surrounding areas.
It's just on an hourly basis or something. It's not recruiting them from the cities. It's recruiting them for work with you in tandem as you do the visits. I guess raids.
I'm not sure I understand your question. I'm sorry.
In other words, let's say you go to New Haven and you get collaboratively with the New Haven police and you train them and they work side by side with you. Are they being paid by you in this, or are they're being paid by the city?
So there are stipends through some federal grant money that we do utilize. We were using ARPA funds for quite some time. We have the Burn Jag grant that we utilize, and it offsets some of the cost to the municipalities.
Okay.
It doesn't cover all of it, but it does supplement it.
So the cities do pay you for the supplemental services that you provide for them?
They do not pay, they don't pay us. They provide an officer to the task force that they have that works for the police department.
Okay.
And then they receive money to supplement the cost of the cost of the officer through the federal grant.
Okay, all right.
It doesn't cover the full cost though. It's right now I think we pay about $1,700 or $1,800 a month per officer.
Wow. So, okay, so because of the shortfall of police we have in a lot of the major cities, what are we doing to try, and are you being forced to supplement them? And is that where that extra hours that you're getting in your budget?
It's been difficult. It's been difficult. Fortunately, in the state of Connecticut, we have had success in reducing gun violence. We've had success in reducing auto theft. And the police chiefs they're committed to working collaboratively. But we have heard from them. We have heard from them. And to the extent that we could provide additional funds to offset the cost of them providing us one of their officers, they would appreciate that. They're still gonna support. They haven't not sent us anyone as a result, but it would be something as we go further to be able to provide to them.
Well, I know New Haven is down. I forgot. It's a large number.
Yeah.
And I think Waterbury, I think all the big cities, Hartford, all of them are down dramatically in their police. So maybe is the recruiting that we're doing, should that be done collaboratively with you guys as we try and get more police officers both locally and within the state police? Is there a possibility of that happening as a team effort to go out and recruit? I mean, sometimes I know we have some colleges that have programs for in the field.
Yeah.
How do we do a better job of trying to recruit more out there?
So Rep. Walker, this past fall, we actually held a recruiting fair at our police academy in Meriden. And it wasn't just the Connecticut State Police. It was the Connecticut State Police joined by probably 50 or 60 other police departments in the state of Connecticut and the military that came to the Connecticut Police Academy to recruit. We're looking at partnering this spring with Major General Yvonne and right across the street from here, and doing something here in Hartford to do just that. So we all believe that we're stronger together, and to the extent that we can work together to recruit, because whether you're in a state police uniform or you're myself in a suit, we're all recruiting. We're all recruiting, and as such, every member of any police department, as such with the state police, they are the living logos of their agency, and there's an expectation that they're out there recruiting from where they are as well. Just yesterday, I had a young man in my office who was 27 years old and wants to become a police officer. And I met with him, with Sergeant Biggs, who's here today from the Connecticut State Police, because someone referred him to me, so I met with him. That's our job to recruit. So, and I know other chiefs that are doing the same thing. So it's important, but the first step that we took was to do this collaborative law enforcement recruitment fair. And we're open for other ideas on how we can partner with the chiefs, the CPCA, and other agencies as well. We have to think
I
creative.
think we've got to be creative and somehow we got to make it make it out to be what it is. And it is a profession and make it like the commercials say, be all you can be or something like that. I don't know. Or is it the Army? I don't know.
That is the Army.
Let you have that.
Yeah, okay. Whatever. My husband's gonna get me for that one.
Let's text him.
Well, thank you, sir. Thank you for your answers. I want to make sure that somebody is monitoring the new task force that are out there and making sure that we're doing exactly what we should be doing. And I don't know, and sharing it with the community, because the community has to feel that security too. And I think that's part of the thing, because my community asked, well, are we getting any help from the state police? And I don't think our police departments really share that as often as they should, so that they understand that, as you said, Connecticut, we're all into this together and we all should make sure of that. So thank you very much for that.
Thank you. I appreciate it.
Rep Walker, if I may, I'll share with you all now, since we're here. This Tuesday, we have in fact convened chiefs from around the state to talk about our statewide narcotics efforts and our violent crime efforts, and to include our crime data efforts. That's going to be Tuesday at our headquarters. So we are doing that. We're bringing the chiefs in. We're sharing information about where we are in terms of crime trends in the state of Connecticut, and then we're going to talk about our violent crimes efforts and our stolen car task force efforts as well.
I hope that a lot of people can hear about it, because again, the more we get out there to the public, the better off we are, both for the people who are looking for protection, and then for those people that are getting in trouble, to know that we're collaborating very well together and we are not going to let these happen in the community. So I thank you for that. Thank you, Madam Chair.
Representative Nolan.
Good afternoon, sir. Thank you, Madam
Afternoon, sir.
Chair. First, I love the suit.
Thanks.
You know, I got to comment on that. It's just,
I don't even know what that means.
hey, that's, couple things. One, first, thank you for what you've been doing since you've taken over. It's we know it's a lot of work, and you and your staff have made some great strides to doing what should have been done years ago. So I thank you for that. It makes me think, when I was back on the force, though I don't miss it, I wish I could have taken advantage of a lot of the things that have happened in the last couple of years, because there are some great things that give our officers the ability to take it up a notch. So thank you and your staff for all that you are doing to make that happen. I just wanted to revisit the computer system and just learn and hear a little bit about where we left off on it, what we might need to do with it, the updates. Is there anything that hasn't been done in regards to that?
Rep Nolan, I believe when you speak to the computer system, is that relative to Clean Slate?
Yeah.
Thank you. So if I may, when I arrived here and started to assess where desk was with Clean Slate, it became immediately apparent to me that this was likely the most complex IT project that the state of Connecticut has ever taken on. And the state of Connecticut should be proud that it is pledged, it is the law, that we are going to do something that no other state has done. We're not talking about just erasing records for those that are eligible in judicial or in corrections. We're talking about erasures everywhere. I am troubled, though, that we have not restarted those erasures yet. We have 13,000 erasures so far. It is our expectation that erasures will begin this fall. So what have we been doing? What are we doing now? We identified a very capable project manager. We've identified that project manager in our team has also asked for and received additional vendor support as well. We've also, we're working more closely with DOC, judicial, and other branches to get this work done. We have met with members of Connect here in Hartford. It is our hope, we're going to be meeting again in another 5 or 6 weeks. We're likely going to invite them to our headquarters, because I want them not only to hear about what we're doing, but I want them to meet with some of our staff that are actually performing the work. This is important. We know, and I have heard time and time again, and it has resonated with me, that justice delayed is in fact justice denied.
Right.
And I take that seriously. I take that seriously. So although I am troubled that we have not fully delivered, I can say that under my leadership and with this team, we have put the infrastructure in place to deliver on that promise.
So is there a need for some robust funding for that, or is that something that was set aside already to accomplish that?
We have asked for and received bond funding for that. So
okay,
we're in a better position. We will be in a better position than we were when I first arrived.
Okay, and I don't know if it was 2 years ago, we talked about a system for our JVs for connecting to the towns. Is that something? No, I thought we were trying to put together some kind of computer model to connect issues with towns and JVs, so that there would be one computer that towns can go to. Okay. All right. So next topic would be back to that phlebotomy issue. Um, a good thought, but it might be best to make that like a pipeline position for some of our phlebotomists that are coming out of school to work for the police department, and maybe have an on-call service for them, because it's not an 8-hour-a-day thing all the time. But it might take some of that, some of the time that would make our officers invest in it, and make it easier for them to work on what they're hired to work on instead. It's not a bad idea to have officers do that, but I just think it's time consuming. And that maybe it might be a good idea to have a job pipeline for some of our college students to maybe get some kind of work with the police department and close the gap in that area that they might need to get some work.
Yeah, I agree. That's a great idea.
And last question would be in regards to metrics, to see how some of the training programs are working. Is there a metric system that you use with that?
Just to see how the training programs are working.
Once officers are trained in these new laws and the things that we're changing, is there any metrics to try and see how effective it's been or how they're doing with that?
That's a great question, Rep. Nolan. That is something that I can take back to the post council that I sit on. And we have really looked at data metrics within DESP under a program that our new data scientist has put together, but that is an area that we should explore as well. I've been fascinated, and I've often said that we should look at the downstream impact of laws that have been passed to determine, how well they're working. Do we need to refine anything? So for me, just, assessing, the outputs, the training that we're providing our officers, how do we know if it's working or not? That is a question that I can take back to the post council and have with police chiefs as well.
Okay, and not to jump all over the place, but back to your communication, your basic communication infrastructure. How is that?
When you mean our police radios,
Yeah,
things like that. I would say it's pretty good, Colonel. could you speak to that about our communication?
No improvements needed, no updates needed. I mean, everything is nothing's from a long time ago.
Oh, so,
know.
yeah, okay. Thank you, sir. So I will share with you that there's a lot of our equipment that has reached end of life and needs to be refreshed.
Mhm.
So, it is important. We need, as you know, or as you were well aware, we need to provide our officers and our troopers with a sense of certainty.
Yeah.
Certainty that the equipment that we are providing them not just works, but it's the best out there. So when we have things that are end of life, we shouldn't be waiting till their end of life. We should have an ongoing replacement cycle
Right.
to ensure that they have the best operable equipment assigned to them at any given time.
Okay. If I'd be interested in getting some information about what things need to be updated and how we can take better care of trying to implement and get those things to make sure our officers have what they need.
Absolutely.
Thank you, Madam Chair.
Thank you. Up next is Representative Delnicki.
Thank you, Madam Chair. I want to address what I see as a situation here, and that's the elimination of the funding for volunteer fire companies. So these companies typically are running on a very, very, very tight budget. A lot of them are volunteers. And the elimination of the compensation to the communities that they serve, going out there to respond to a call on a limited access highway, in and of itself is creating a substantially dangerous situation for them. Yet the funding is taken out of the budget.
So I don't think that the commissioner recommended that. That was recommended by the governor.
Okay,
So that's something that we can bring back. I don't know if we'll get the money back in or not based
I
on
don't
what
know either.
happens. But he said they used it all. So there's a need. You're right, Representative, there's a need, but it wasn't his recommendation. It was the governor's recommendation, so we can't yell at him. We can yell at him, but
I'm
it's
not
not gonna
yelling
do
at
any
you.
good. Let's just, you don't yell at
I'm
any.
just concerned.
You never yell at anybody, I know.
I'm concerned for my volunteer firefighters in South Windsor who go out there every day protecting the community. So if I sounded a little bit annoyed, please excuse that.
No worries, sir.
So you have a huge fleet of vehicles. What's the average mileage on the vehicles that you have out there currently? And how does that interact with the dependability of the fleet?
Yeah, Rep Delnicki, our fleet is aging, and I would say that the average mileage on a cruiser is about 100,000 miles or more.
And I also see where you've done a good job on saving on overtime money, correct?
Yes, sir.
So I want to commend you for that.
Mhm.
Because that's one of the toughest line items any department has because of all the unanticipated situations. But I want to bring up another issue kind of pertaining to that somewhat. Is there directed patrols to try to pull some of these folks over that are going like 90 miles an hour, literally? Because I've seen them countless times coming in to Hartford. I've seen them countless times going to other parts of the state. And it really poses a very serious hazard to the average driver, because should one of these folks lose control, you could have a massive situation of mass casualties, for lack of a better way of expressing it. So are there directed patrols to try to apprehend these folks and to basically show that there's substantial consequences in a situation like that?
Rep Delnicki, the answer is yes, but I'd like to expand
Good.
on that. please. And I'm also going to ask Colonel Lockman to join me at the table as I begin. The safety of my family, your family, all of our families is the utmost importance to myself and our leadership team each and every day.
And for the record, I just want to say something before I get the answer.
Please.
I'm not saying that the men and women of the state police aren't doing a fantastic job.
Mhm.
But I am wondering, do you have directed patrolling to try to apprehend these folks? I tend to think I know what the answer is going to be, but I'd just like to get reinforcement on that.
So I'm going to ask Colonel Lockman to provide specifics about the Connecticut State Police Fatality Reduction Initiative that began last March, and we've had some success.
So last March, in response to the trend in the fatal motor vehicle accidents, we initiated the Fatal Motor Vehicle Reduction Initiative, and we utilized our traffic services unit with the lieutenant in charge of that unit. He spearheaded this initiative for us, and we utilized a data-driven approach. We were utilizing data from fatal accidents. We were looking to and accidents in general. Where are these accidents happening? What are the most dangerous roads that we have, and how can we try to curb aggressive, distracted, and reckless driving on the highways? So we did direct saturation patrols to those areas, and we've had some great success with that over the course of 2024. When you look at the fatal accidents, when you compare year over year, 2023 to 2024, we did experience approximately 6% reduction in fatal motor vehicle accidents on the highways that the state police patrol, as well as the towns that we have primary jurisdiction in. So yes, to answer your question, we do direct patrols. We do, it's part of a multifaceted approach to trying to curb this driving. We're not just focusing on the enforcement, we're trying to educate. Our traffic services unit also has some initiatives that they partake in to try to educate the public. Our public information office is also pushing the messaging out that the state police are out there. We're enforcing the traffic laws because crimes are being committed out there, and we're not going to tolerate it. And we're in business. We are stopping vehicles. Our public information office through csp.pio@ct.gov. If you subscribe, you'll receive the alerts that we have, and you'll see that we are stopping people for, I believe you said 100 plus, right? 100 miles per hour. Yes. We make sure to make it known that we are out there enforcing those violations to try to curb it as well.
And if you could, and I'm not going to ask for them off the cuff, if you have numerical statistics pertaining to how many folks you have apprehended doing that kind of reckless driving. And it's a nice reminder. Actually, let me rephrase that. It's a sobering reminder to see the traffic death counts on the signs on the side of the road, the electrified signs. Because I think the last time I looked, it was like 315 or something in that neighborhood.
We do have data, and I'd be happy to produce
Good.
that for you. I don't have it with me, but we'd be certain to get that for you.
I appreciate that, and I expect that you probably wouldn't have the data because it's kind of a question that that is not strictly budget driven, but I will ask it based on a budget driven question. If you had more resources, would you have more directed patrols?
It's no secret that we are short staffed, and
right.
We are doing the best with what we have. We are looking at our staffing and the staffing deployment. We are working with our data scientist in-house to do a staffing study, a formalized study. We did one recently, but we're we've ordered the biggest staffing study that the state police has had since 2014. And when that's done, we will know exactly who we have, where we have them, and where we really need them. And we're going to deploy our staffing and our troopers in areas that we believe will benefit us the best.
Well, you're doing a substantially great job based on the fact that I think I heard 1128, somewhere in that neighborhood, was the high point in the number of officers on the line. Okay.
1248. I believe we did touch it, but we didn't stay there for very long. Yeah, we didn't stay there for very long.
Because there's nothing better than a line officer in a patrol car to bring these things under control. And hopefully we can get funding to get the number of officers on the street as we need, because you've got a tough job. You have some very good people. A couple of your officers came from my department in South Windsor, and we were sorry to lose them. And I want to thank you for coming here and answering the questions. And I look forward to the data pertaining to the apprehensions and convictions for additionally there, because reckless driving, the only way somebody's going to learn that it can't happen is if they actually get apprehended.
So we are a half an hour over when we were supposed to be finished, and we have 3 or 4 more people that have questions. So thank you. Representative DiCaprio.
Thank you, Madam Chair. And thank you, Commissioner, and your whole team for being here, and very informative today. I was going to talk about, we'd improved the compensation package, and hopefully you're getting more candidates, at least applying for positions, to eventually bring up your staffing, because you are down several hundred positions. And I think it's an excellent plan, redeploying your troopers and then backfilling those positions with civilian staff, wherever you can. Is that something that's ongoing right now, that initiative?
And it's in a smaller way, yes. It is difficult though to do until we have the civilian staff to fill those positions. What we have done is been very thoughtful about assignments. I made some changes recently within the agency to align us for success, and we're being very, very critical of assignments right now. So, and when I initially arrived, we looked at how we can get some more people out on the road. We did that, but a more longer term comprehensive strategy needs to be undertaken as soon as possible.
So I think from discussions yesterday, 75 positions potentially could be redeployed, but this will come with your staffing, your study, right, with your planning. So it's not something we're going to see very soon. Just one last question, as a former state employee in the Department of Environmental Protection, running the hazmat division. One of the things was how to reduce overtime. Can you share just some highlights of how you reduced overtime, in your agency?
That's a great question, Rep. DiCaprio. So first and foremost, let's look. We looked at existing practices. We looked at existing processes for assigning and approving overtime, and we also we increased our controls over that overtime. And the colonel and all divisions for that matter, but specifically because the Connecticut State Police is responsible for 92% of the overtime in the entire agency. It was important that he and I and his team, we spent a lot of time together. Again, we don't want to reduce services, but at the same time, what are some things that we could do to reduce overtime? We've identified some things with regard to recruitment. again, without letting anything fall by the wayside, we found that we can reduce some overtime expenditures there. We've also looked at other areas just in terms of assignments. You know, we've looked there as well. Colonel, could you speak to some of the additional things that we've done? I feel like you want some more specifics about that.
Thank you for the question. So we've gone line by line through each bureau, each unit, each troop, and we're looking at even little things such as the way that the schedule is lined up. You can save a few hours in situations like that. We're utilizing technology more than we previously were. So utilization of technology through our intelligence operations unit, they're saving us substantial amount of trooper overtime when when they're supporting investigations throughout the state for our troopers, detectives, utilizing them to scour social media accounts and to review different databases. That saves on troopers overtime as well.
Okay, thank you for that. Thank you for that. And over 7%, that's wonderful. So good to hear that. And maybe we can have an offline conversation too. Thank you very much. Thank you, Madam Chair.
Thank you. Up next is Representative Baker.
Thank you, Madam Chair. My question was answered, so I just wanted to make a brief comment. Thank you for coming out here, you and your team. I've heard so much, and being from Bridgeport, one of the things as well we said is like, we're the state police, we need help, but you are definitely in doing some things, great things, working and collaborating and doing things in the background to push enforcement and things to come out in the front. So continue to keep up the good work, and because of the things I heard, I can be a cheerleader in a sense and tell people what some of the things that you're doing out there. So thank you for coming out here.
Thank you, sir.
All set, Representative? Relative to the working group, can you bring to the working group what we have for barracks upgrades coming up?
Yep.
I am particularly interested in Troop E, which was the old toll booth. And so it's been around for a long time, really needs some upgrades to that. I have to tell you that I'm a huge fan of the resident trooper program. I think that gets you out in various parts of the state that are that would never see any police officers, and I really appreciate all the work that you do with completing that part of the mission. And then relative to the pistol permit and the sportsman's activities, so the Olympics still run rifle, pistol, skeet, and we have teams of people in the United States that participate in the Olympics in this area, and we have children and young people who are participating in youth pistol, rifle, skeet competitions. And so if you're still interested, I'm hoping that you can have either somebody from your team or somebody else there if you think that it's appropriate.
Absolutely.
So, and that's what I have. Does anybody else have anything else? No, no, do I?
I'm sorry,
Representative
just
Walker.
one more. I was looking over our OFA analysis on overtime and things, and you had a let's see. In January, you had 4.3 deficiency, $4.3 million deficiency. But as I read it, it says that the agency had a personal services holdback of $1 million that contributed to that 4.53 deficiency. And it also talks about the fact that they had not updated your personnel in the amount of people that were working, and because of the fact that we did not have a budget last year and all that. So therefore so you had a deficiency that really was out of your control. Interesting. I've never seen that type of write-up before. That's fascinating. You want to tell us what it is? Go ahead. You could speak, can't you?
Yes, sir.
It's good to see you again. Good to see
You too, Rep. Walker. Thank you. There was a holdback last year. There is a holdback this year. I think that what we are all banking on is the overtime reduction efforts that the commissioner was talking about, to greatly reduce that January number. I saw the January number you're referencing.
Yeah.
But, as the commissioner said, our preliminary numbers, looking at 3 months of our overtime reduction initiatives, paying attention to that, we've had a 7.5% reduction in OT. So our hope is that that will continue and that will resolve or greatly lessen our deficiency for this year.
I hope we can resolve that because that would help in paying for some of the other things that we want to do in your agency. So,
That's the hope.
I mean, I'd never seen that type of write-up before. And I think the last one I do, Western Connecticut University had a program that was it was called school safety or something. And it was originally paid for through ARPA funds, I think, from DESP. And then is it still in existence? And is it still on your books?
I could get that for you for work group.
Okay, and how many people are in that, if that's the case? Because one of the things that we were concerned about was the fact that it wasn't a certified program. It was something that was put together, which we all have, that's how we start. But the concern was what their aims were and what their goals were. So we would like to know a little bit more about it.
We'll bring that to work group.
Thank you. I'm done.
Anybody else? No. Thank you very much. Appreciate it.
Thank you.
So we're going to close our meeting for Regulation and Protection Subcommittee. And we will see you all
3 o'clock.
at
3 o'clock.
No,
Secretary of State.
4 o'clock for the budget hearings. Thank you.
No, ma'am. 3 o'clock for the Secretary of the State for General Government A
General Government A.
at 3 o'clock.
The voice of the voice. She's always watching.
Yeah, you don't want to see the face with the voice.
Just talking about